Delegate Gardner,
Here.
Senator Favola,
Here.
the Honorable Chris Jones,
Here.
Jennifer Siciliano, Heather Jones.
Jennifer, you're muted.
Oh, she's present.
Sorry.
She's here.
Okay, Heather Jones. Looks like she's in the room, but is on mute. Secretary Kelly,
Craig Markfa here, representing Secretary Kelly.
Secretary Cole, and Delegate Sickles.
Here. Okay.
You have a quorum, Mr. Chair.
Thank you very much. I hope this won't take too long today. We had a lot of policy options that some of them maybe can be combined or eliminated based on, existing authorities. But we're going to start with an overview from Mr. Amigo. Wade.
Yeah.
Mr. Wade.
Thank you, Mr. Chairman. So I'm going to just give a 5-minute overview to kind of put everything in context so that everyone knows, how we got here, and hopefully we can get through things very efficiently. So when the draft final report was completed, it was provided to the subcommittee chairs. The subcommittee chairs provided that document to the individual subcommittee members. It included observations and recommendations. And when it was sent out to the subcommittee members, it was with the understanding that Legislative Services was going to be establishing a range of policy options. It could be legislation, possible budget amendments, or just some other language. In addition, the subcommittee members were asked to provide any comments they had. When we got to the second step would be when we got to the full joint subcommittee meeting on the 29th, we initially looked at the observations and the recommendations, as well as a sort of a central document containing all the possible policy options. It was decided at that meeting that each of the individual subcommittee will have an all virtual meeting to go over the policy options within their subject matter area and reach some general consent for to go forward to the full joint subcommittee meeting. So the purpose of the meeting today is to go over those policy options. What we have done as staff is we put together a document that we're calling the discussion document. So what we tried to do is when we sent out the first policy worksheet to the subcommittee members, we asked them to just check if you think a particular option should go to further study, or if you thought that it should not be discussed further. We've put together this discussion document that goes through all the worksheets that we received and sort of provided for each one the initial member feedback. What that means is no one is sort of locked in any position, and what the yes means is yes, we should discuss it more, and what the no means is no, we probably shouldn't discuss it more. But of course, since we're not taking votes today, I just wanted to see I want everyone to see the lay of the land in terms of where we are now. So what we can do very efficiently, hopefully, I know we can, is if we look at sort of 5 available actions, legislation, study, a budget amendment, best practice recommendation, or no action. And I think a 6th one could be a letter to the agency that's involved to ask them to look at it. So it doesn't have to be legislation, it doesn't have to be a study, it doesn't have to be a budget amendment. It could be anything as small as a best practice recommendation to the agency that's involved, or a letter to a responsible entity to ask them to look into these things or make sure that they consider them. So that's where we are, Mr. Chairman. So hopefully it will give us sort of a roadmap to efficiently work through these as quick as possible.
Does everybody have any understand that or have any questions of Mr. Wade before we start? Okay, let's get rolling.
All right, and you'd like for me to go ahead and
yes.
Okay, all right, and so the first recommendation is 1.1.1. It's on page 1, and it has a total of 4 policy recommendations. You can see through it. The first policy recommendation has the initial feedback with Ms. Siciliano and Dr. Jones saying it should be discussed further, and Delegates Sickle and Gardner saying that it should not be. The second option has Delegate Sickle saying that we should go forward or consider Senator Favola, Delegate Gardner, as well as Ms. Siciliano also saying that we should go forward. The third the third option under that recommendation has Senator Favola, Delegate Gardner, and Ms. Siciliano saying that we should go forward. And the third one has Ms. Siciliano, the fourth one has Ms. Siciliano saying we should go forward. And Senator Favola and Delegate Gardner saying that we should not have further discussion. So I think, Mr. Chairman, what we may want to do is sort of have a discussion about these recommendations and figure out which ones we want to go forward with.
Okay, now going back to one here, where I said no to for some reason. Instead of responding to the healthcare crisis, systems should develop proactive mental health support systems that are continually available. So I'm thinking that I probably said no here based on this would not be legislative or a budget amendment, but I have no problem with that being a best practice recommendation.
Yeah,
You
I think, Mr. Chairman,
I
I think
personally
what you said was that you think that that this should already be being done. But so excuse me, I mean to break in.
Yeah, no, please feel free. Is that, is there any, ideas here from anyone on how we should handle that first, number one? I'm
Well-
saying it should be a best practice recommendation just for the purpose of discussion. I don't really care, but, for the purpose of discussion, I'm saying best practice.
And I said no, Delegate Sickles, because first of all, I thought we should already be doing that. And if we shouldn't, it was just the best practice. It shouldn't be any type of legislation.
And I would agree with that.
Okay. Anybody else want to voice an opinion?
I'm
If not-
fine with the best practice.
Okay, good. That's going to be a BP. All right.
Okay,
The next one, resilience training, provide resilience, stress management training for healthcare staff, equipping them with coping mechanisms to handle intense pressures. Okay, so I don't know how resiliency training during a worldwide pandemic emergency, routinely. I mean, I think that's kind of similar to number one, but what does everybody else think?
Mr. Chairman, I think it could be contained under number one. I guess I have a general question. I'm sorry I didn't speak up earlier, but
Please.
not all of these are going to be legislative or budget proposals.
That's
Some
right.
of these you're going to put in a letter to the Department of Health. I mean, that's sort of what I was envisioning.
Senator, did you hear Mr. Wade explain the six things we could do with this at the outset?
I did. I think I did, but
Okay, it was legislation, recommend a study, budget amendment, best practice, recommendation, do nothing, and send a letter. Those were the six.
okay,
That's
so when I
backward.
responded, I'm just speaking for myself. I may have been thinking that we were talking about legislation or
If-
budget. I wasn't thinking letter, best practice, or do nothing. So just so I will adjust my thinking.
So,
So-
but, your point may be a good one here, that this should be part of the number one.
Yeah. And it's a best practice, right?
Yeah,
yes.
Yes.
okay.
I would
We-
concur with that.
If I may, Mr. Chairman, just to follow up on what Senator Favola said. Senator Favola, what the point that you made in your worksheet was that this type of training, or this stress management training, should be something that should be done before the emergency occurs. And so that just wanted to make that point.
Yes, I believe that. It should be part of their regular training, whatever their training program is.
Okay, any objection? Okay, number three, increase funding for mental health services, likely be required to carry forward this recommendation. Necessitating a budget amendment.
I mean, we've got a lot of, Mr. Chairman,
Yes,
We-
Senator Favola.
we've got a lot of, so I agree, it should be a budget amendment. I would leave it at that. But there are a lot of proposals floating around to increase the behavioral health services. Some would be linked to schools, some are linked to community
Mhm.
health services. So,
Um, so if you take in context the next one, which would be a budget amendment to expand existing programs sufficient to fund program expansions. So, this is Sickles here. I would say no budget amendment. Take this out of there. Take this out of their hide, so to speak, over the health department. I mean, look, I'm not. If you heard the last thing I was in today, I'm not for giving the health department any more money until they show they can do something without corruption or inefficiency or anything, along those lines. But this, to be fair, you said give this to DBHDS, which is not the health department. So I would,
I agree with you. I put no down on number 4. So I'm in the same place you
Yeah.
are.
if we knew what the expansion would be, I might be more interested in hearing about it. But the number 1 and number 2 are things that really should be part of a best practice that's ongoing within an agency, you would think. So, and there's going to be a lot of budget requests as we get through this document.
Right.
So I would say put these 2, 3, and 4 on hold as far as, I would put them in the do nothing category. Is that right? I would not recommend a budget amendment at this point in time.
Okay.
Any other thoughts?
I agree. I was a no on that, on number 4 in particular, Delegate Sickles for that purpose. So
Okay, I mean,
I'm
yeah.
fine.
Anybody, are there any objections? Is just so 3 and 4 would be do nothing?
Yep.
Right. And
Okay.
2 is under 1 as a best practice.
Right, correct.
Right.
Okay.
Okay.
All right. Excellent. Moving on to 112, develop comprehensive mental health support guidelines. For recommendations above, direct DHRM to create and implement clear standardized guidelines for mental health support during during the emergency.
I mean, this could be a best practice too.
Okay, anybody other thoughts? Just speak up.
best practice, I agree.
Ditto.
Okay, that's 3 BPs. Any,
Is that, Mr. Chairman, excuse me, is that for all of the recommendations under 1.1?
I don't know yet. I don't
Okay.
know yet. Let's read the section 2 then. Feel free to object at any time, anybody, to anything. Section 44-146, establish the powers and duties of the VDEMs, could be amended to a provision requiring the department in cooperation with DBHS to develop standardized guidelines for mental health support during an extended incident response across state agencies. Could include a requirement to establish definition and designation time period for extended incident response. Okay. So I'm not necessarily against having a special program for behavioral health, mental health during a period such as we went through.
Right.
Do we need to put that in the code anywhere, or is that just another best practice? Does anybody have thoughts?
I said yes to the legislation because I did not see anywhere where the definitions or the designation of time was there. That
Mhm.
was why I was a yes to possible legislation.
So you're saying like if some kind of a crisis emergency is going on for a certain period of time, funding should be made available to address behavioral health and mental health needs during that period.
During that period.
Mm-hmm. when you're saying that it could be legislation.
It could be.
Yeah.
I'm not tied to that, but I just thought it was important that we had a specific definition and a time period, so it wouldn't be like
Mhm.
indefinite.
Mr. Chairman,
Yeah.
I think we're going to have to put it in legislation if we really want it to
Yeah,
happen.
and probably need some money as well.
Right.
VDEM did concur with that, Mr. Chairman.
Oh, okay. All right.
There will be legislation and a budget amendment, Mark, is that right?
Yes, sir.
All righty.
Okay. I didn't get to number 3. Alternatively, a resolution could be introduced directing the department or a selected group of relevant agencies to study development of comprehensive. Okay, so that's overcome by events.
Correct.
Okay.
Yes.
Dude, that's a nothing then, but due to what we just did on above. All right. Communications, amend the code to require expert pool, subject matter expert pool for key agencies to be trained and readily available during emergency.
Mr. Chairman,
Yeah,
if I may,
Mr. Wade.
I think one of the comments that you provided earlier was you asked if VDEM already does something like this,
Yeah,
and I think that's so we can ask the representative.
Yeah, I can't imagine that they're not already doing some of this.
Yeah, the was already addressed in Executive Orders 41 and 42 back in 2019. That's what VDEM has supplied us with.
yeah.
Be addressed Executive Order 41. This is, and if this is in reference to the Joint Information Center, the plan and identified agency SMEs already exist. So
Is the Joint Information Center the number 2 here? So the on 211, we're dealing with just having subject matter experts available and trained, and we are saying what, ladies and gentlemen? We're saying that they already should be doing this. They should have subject matter experts available, trained in how to communicate potentially.
yeah, Mr. Chairman, could I request that Sean Polster, who's currently an attendee, he's with VDEM. He's been asked to appear here today to
Absolutely.
supply with, if you can make him a panelist, that would be great. Sean, you're on, so you can unmute yourself.
Good afternoon, everybody. So yes, sir, to answer your question, Executive Order 41 back in 2021 was amended by Governor Northam to amplify the adjunct emergency workforce, supplementing with Virginia state employees during an emergency. That happened during COVID, and we can amplify that message with this. And to your point, sir, create this as a best practice and even expand that program.
Okay, so you see benefit of making it a more official part of your duties to be better prepared next time. Would that be fair to say?
Yes, sir. We could revise Executive Order 41 if that's the recommendation, and work with the legislators and as well as the governor's office.
So this is in the communications category,
Yes,
and
sir.
one of the things that we heard, it wasn't necessarily a state issue. One of the issues we heard, rightfully or wrongly, was that the government was giving conflicting information. Now, people were learning about this as they go. So, you know, they got criticized for saying something that was probably accurate when they said it, and then they learned more and said, well, you know, so that's politics in a way. But we want to. The idea here is that we want to better communicate during these emergencies. And everybody agrees with that generally. So, okay. So this would be a best practice, or do we need? You said you need legislation for this?
No, sir. I'm sorry. Go ahead.
Excuse me, sir. If I may, Mr. Chairman, I think what we're saying is that we will adjust this particular policy option to make it a best practice.
Okay.
Need legislation.
Any objections?
No.
Okay.
Yeah.
Okay, good. 212, implement a centralized information system, SIMS. Okay, amend the code. This is legislation to implement this system, deploy centralized platform managing disseminating information during a crisis, real-time updates, guidance from the SMEs. It would streamline the flow of information, enabling accurate update content.
We need like,
Okay, I mean, that would be, to me, common sense in a way, but something you need to put attention to.
Mr. Chairman, there were a couple of other, you had indicated in the earlier comment that, this would be a good idea if it could be implemented seamlessly. And Ms. Siciliano indicated that, if this is done, that it should be integrated and aligned with existing, data sources so that they can work together.
In other words, we're not creating a new website or asking people to go somewhere they've never been before,
right.
or that type of thing, or just.
Yeah, and not just, yeah, I'm sorry. I think somebody else was going to speak.
Senator Viola.
Thank you, Mr. Chairman. I read this to mean we would need a budget amendment as well. Is that,
Well,
how do you
I
implement a
mean,
central?
no, I mean, you probably would if we do this. What does the administration think? Mr.
So-
Polster?
Yeah, Mr. Chair, if I can just address this for a second. What we're doing is taking a retrospective look at events that occurred during COVID. We learn from every opportunity or every emergency we have in the Commonwealth. We have since refined our Joint Information Center communications method. Hopefully during Hurricane Helene, the legislators saw the calls that we had on a regular basis with a regular cadence to keep you informed. So those are some of the things we've already implemented and that we can adopt as a best practice and update EO 41 or 42 as needed, sir.
So, Mr. Chairman, I think if this is a best practice, why don't we just put this under the best practice category, and then they will come forward at a later date with legislative requests?
Okay, yeah, I think that's good, but let's hold on for a minute because we got 3 and 4 here. Let's see if there's anything else that comes out of that. Public communication frameworks, develop a uniform public communication framework that simplifies the delivery of consistent, accurate information to the public. I thought we kind of already dealt with that. And then here's code section, in section 44 something, Division of Public Safety Communicate, establishes Division of Public Safety Communications. This section could be amended to direct the division to establish centralized messaging platform during times of emergency. So if we agree that what we said earlier was the best practice, and we're satisfied with the current state, since they did a better job with Helene a couple weeks ago, you also want to leave all this in best practice, or does anybody think we need this new division?
I think best practice.
Okay. Anybody else have a view out there? I didn't, I guess I heard some good things about, our response to the flooding in Southwest, a good response. And was there a communications issue? I'm just asking, I don't know. Was there, because this section is on communication. Are we doing a good enough job? Administration seems to think that they've improved the situation, and I remember in the past when the big hurricane was coming to the East Coast, boy, did we get communicated with. I don't know.
Right.
I don't know if that was good or bad, but we were definitely communicated with.
So, Mr. Chairman, did you want 1 through 4 under 2.1.2?
Yeah.
The 1.4?
That would be.
Did you want to combine that into a general directive? I guess I would do a letter.
Are we talking about the 4 sub recommendations under 2.1.2?
Yep. I guess I'd combine them and I would do a letter to Virginia VDM, I guess.
So what would we say?
Well, I would say I would expect best practices, communication systems that, interface with localities, better coordination, and then to come to us on an as-needed basis for money.
If I may, Mr. Chairman, just to follow up on what Senator Vagola has said, what could happen is staff would draft a letter for the co-chairs of the joint subcommittee to send to VDM, and then I'll make sure that what we've talked about today is included, and we'll try to have it ready for the full joint subcommittee meeting. But that's what the letter would look like, and some of the other subcommittees, the other two subcommittees, are doing something very similar.
I have no problems with the letter.
Mr. Chair, may I add one point of clarification, sir?
Absolutely, Mr. Polster.
So section 4, sir, the code section 44-146.
Yeah.
That is specific to PSAPs, which is public safety answering points for 911 centers. So that doesn't really, it's not really germane to the conversation as far as the JICs and communication. Just for a point of clarification, sir.
Okay.
Yeah. If I may, Mr. Chairman, that option would basically ask the that particular division to establish that messaging framework. So if you want that to be taken out, then we could just have the letter include what's in the 3 options.
Mr. Polster, what would be the harm in expanding the mission of that department?
So I don't think there'd be harm. The JIC is run through our agency, but is incorporated with every state agency within the Virginia Emergency Support Team. So it's VDH, it's all VDOT, it's all the agencies that come to one. To your point, sir, ensure we're having one message that we're sending out to everybody. I wouldn't say there's any harm in that, sir. I just think that it's currently addressed in the 2019 version of EO 41.
Well, I'm okay with not having this subsection 4 in it, in the letter.
Okay.
What does everybody think?
Fine.
That's fine.
I'm good.
Mr. Chairman, before we go on, if we can go back very briefly to recommendation 2.1.1, I don't think I got the consensus for the second item, which would establish a public safety communications response council. I don't recall the subcommittee discussing it, but I take it that that there was a no on that.
Oh, they were going back to a 211. Yeah. Okay. Okay. Let's finish 212 first. Everybody's okay with the letter.
Yeah.
Okay. And so now we're going back to 211, and we talked about this being a best practice. And so we're rejecting the recommendation that we amend the code, right?
Correct.
And it said we were going to expand and revise the executive order that was already in place.
Right.
We actually combined 1 and 2 as
Yeah.
All right. Thank you.
Is that okay, Mr. Wade?
Mhm.
Yes, sir.
Okay. All right. Moving right along then, we are moving on to 221. We're going out of communications now. Streamline the health equity working group structure. And our first on 211, we've got amend the code, reduce the size of the working group to a more manageable number of participants. Focus on key representatives who can provide diverse perspective without overwhelming the decision-making process. Establish smaller specialized subcommittees for specific tasks. Yeah, so this is something that I did not experience myself, but apparently they had when they had a working group that I do remember when we first we didn't have a lot of vaccine. When we first got vaccine, we got 50,000 doses a week from the feds, and we had to distribute that in an equitable manner. That was kind of crazy. That was before people didn't want it. Everybody wanted it then, when it was first coming out. I mean, my phone was ringing off the hook. How do I get it? All this stuff. And we had to make sure the state was, but apparently, that's just an example. There may have been other things. That's what we heard in our office. Apparently, there were other things that we were worried about, equitable response. And this recommendation says it was too big. The working group was too big. So I don't know how to respond to that. Anybody, does anybody want to jump in here?
Mr. Chairman, I think I'd be cautious about putting something in the code that actually talks about the specific, who should be at the work group, who should be, what group should be represented. I think all of that is best practice in my mind for both 2.2.1, number 1 and number 2. I guess I'd put it under best practice. But I'm open. I mean, I don't mean to fall over my sword by any stretch.
Well, let's read number 2 here to see if the two of them together make any more sense here. Okay, section 44.146.18 of the code could be amended, or alternatively, a separate section could be created to require VDEMs to establish a work group on health communications and equity during a statewide public health emergency. The legislation would seek to establish a clear upper limit on the number of participants in the work group and include required subject matter specific subgroups. Okay, so that is more specific than number 1. It kind of gets to the point.
I would try to combine them, I think, into a best practice.
I would too. And that's why I said no before, because we don't know what kind of pandemic. And when you start putting it in the code, then I think that limits. If you say if we have X amount and then you don't have that many, people with experience or expertise in that area, then you're underperforming. And then I just think we don't want to lock ourselves in like that.
Well, let's ask the administration after having gone through this. Did you agree that your group was too big, Mr. Polster?
So,
yeah.
So, sir, I wasn't here during that. I apologize.
Okay.
I will defer to VDH on this as well as a kind of a joint response. I will say there is already a framework in place under the Commonwealth Secure and Resilient Panel for the Secretary to have an emergency management awareness group with certain key officials to be called in the event of a state of emergency to share critical information and et cetera. So that's one of the opportunities that exist. We could also work, to your point, sir, and the committee's point of creating best practice to do this. But I'll also defer to Craig for a response.
Yeah, only thing I'd want to add is that whoever the governor is could control this through an executive order or executive directive.
Yeah.
And but as best practices go,
well,
there was a lot. I mean, we all remember how just the chaos and everything there at the beginning. And so everyone was kind of stumbling all over themselves to try to figure out where to go and how to make things happen and meet all the demands. So I do think I concur. I do think it's a best practice. And whoever's in the governor's mansion at the time could handle could direct the agencies in an executive directive is get it going immediately.
So
I don't think legislation in the code is going to resolve this. I concur.
I would not fight over something like this, but the alternative view is the governor is going to be under pressure to add this group, that group, this group, another group, and legislation would help him say, or her, say, hey, the code says we can only have 15 people, and that might help the group not expand or whatever. I don't care though. So,
Mr. Chairman, I was just going to say, the governor could create multiple groups too. A communications group and, infectious disease group,
why don't we ask the administration to give us an ideas on how this can be handled in a routine manner next time?
Sure.
How do you think about that, Mr. Markva?
I think we'd be happy to take a look at that, and we'll get our teams working on it. So
okay, that means we're going to ask for that in a letter.
Yeah.
Okay, we'll send you a letter.
I guess, Mr. Chairman, my overriding comment is for most of these things, there's nothing prohibiting the agencies from responding to these good recommendations. they're all within the purview of the executive branch. The governor could do it through executive order, all of these. It's just a question of providing a blueprint and maybe some money. So, I mean, to the degree you want to do the blueprint in statute, I think that's sort of the bigger question. And whether we want to establish, and whether we want to do a budget appropriation at this time, I would think not, but in my mind, I mean, those are the two things. I mean, this framework, we could give guidance.
Let's keep going because we got a lot more to do and come back to that larger point. Senator, if it's okay with you. And we're gonna, in this to streamline the health equity working group structure is going to be, we're going to send a letter and say, hey, let's try to do a better job next time. Okay.
Yep.
Moving along to 222, implement clear decision-making protocols. Okay. Amend the code to develop and enforce clear protocols for decision-making within the working group, establish criteria for resolving conflicts and making decisions swiftly to avoid delays. This could include pre-defined guidelines for translation and other critical aspects to streamline the process. Number 2, there can be some discussion of the need to establish information line where healthcare providers can call to ascertain clarification on policy matters. Okay, Code of Virginia again amended or alternatively separate section created, directing the VDEMs to require the establishment of previously mentioned work group that would contain language requiring the group to develop a framework for decision making. Statute could contain a requirement a quorum of members be present, and number 4, legislation directing Secretary of Public Safety and Homeland Security or VDEMs to convene a work group to pre-establish a health equity work group structure, protocols for decision-making within the group. And this starting to sound a little bit repetitive to me about stuff we've already talked about a little bit. But so what they're saying here is there was no decision-making, not routine, but how, the decision-making framework, right? They want a framework to how decisions are going to be made. I'm using the word framework. Maybe that's the wrong word. Obviously it's a communications thing. Decision-making needs to be clear. I mean, come on, we're in a worldwide pandemic with a lot of not good information all the time, but they want us to do better on that, I guess. So I'm just rambling here. What do y'all think?
I don't think you're rambling. It's hard to prescribe what the next one might look like. I mean, as you said earlier, what was thought to be a valid approach in the beginning or about right information was found to be further enlightened as we got further down the road. And I don't know how specific you can be with some of this. I think it's, it's best practices communicating between the various parts of government. I just think there's a lot in here that probably doesn't need to go any further.
Yeah.
Yeah. Implement clear decision-making protocols. That's the title here.
Yeah.
Implement clear decision-making protocols.
How do you legislate that? I mean,
Exactly.
Yeah.
I don't think you can.
What clear is to me might be different, might not be clear to you, right? I mean, it's just, I don't see how you do that.
yeah,
You
it's,
have to be able to hold these, agencies accountable, and that goes to the executive order and the executive branch, and responding in kind when something happens. But doesn't mean don't prepare for it. I mean, what does the administration think?
Well, it seems rather obvious having clear decision-making protocols. It's not, generally speaking, nobody sets out to be confusing and chaotic. I think the circumstances tend to have a greater impact, but I don't see anything in here that really needs to be added to the code. Frankly, a lot of these things, as far as information lines, I mean, we've really prioritized putting a lot of things out on the web, out on their individual websites. We've definitely improved the amount of information available on the specific agency websites. And I do think VDM, they're looking at, they've made I think they would support the idea of having an all hazard approach rather than just a health approach.
Mhm.
So nothing is done in a vacuum. And VDM and VDH, Office of Epidemiology, they were working around the clock. I mean, staff for VDH were working 7 days a week. So a lot of decision making going on, and I just don't think that there's any. I don't think any of these specific things are going to add anything. So I would just say no.
Yeah, so there we got one vote for nothing here, maybe more than one on the nothing alternative.
Nothing for me.
Okay,
Mr.
all right.
Mr.
Now-
Chairman.
No,
Mr.
yeah, Mr. Wade.
Yes, and I think this might help things along. I think that there is nothing that says that you all have to accept any of the options. Let's say if you all decided not to go with any of these policy options, then what would happen is you would have the final report from Tidal Basin that would have its observations and its recommendations, but there doesn't have to be a response to each of the recommendations. That report would stand on its
Yeah.
its own.
Right.
Are we going to have something in the future here that talks about the relationship between VDEMS and OEMS over in the health department? Because that could use some work potentially. You had two, they're in different secretariats. OEMS has had a little bit of scandal lately, to put it mildly. It's been, I'll let that hang out there for a while. Let's keep going. 223. Establish a rapid response framework. Okay, the code could be amended to require establishment of previously mentioned work group with responsibility to develop health messaging protocols and policies to support rapid response to changing public health needs. Okay, that's the only policy option there under 223. So yeah.
Yeah, I think VDH had a working group during the they just established it during the pandemic. I don't there's just too much. I think that was a common sense thing. I don't know if the code needs to be amended here.
I would agree. Yeah, I would agree. And again, this is something the governor could direct through an executive order or
as needed.
as needed. Yeah,
Yes.
I'm just very anxious about putting things in code when we don't know the nature of the next.
That's the conservative nature of the senator from Arlington. Yes.
Don't you like Arlington? You're right next door.
No, I love Arlington, and I'm not right next door, but not that many miles away.
I like the way the good senator thinks.
So we're going to say nothing on this one.
Right. I think it falls under lessons learned.
Okay.
That's good.
Well, maybe somewhere we should say in the final report, we're going to say this somewhere. Rapid response, responding as accurately as possible to the public's need to know is important, whatever. Okay.
And involving stakeholder groups and coordination and communication. And we can do that in our letter.
Yeah. Okay, 231, enhance ongoing public engagement and education. Establish information line where healthcare providers can call to or ascertain clarifications on policy matters and the time and dates when future guidance calls or memos will be available. And then the code could be amended to require that any work group created or established during a declared time of emergency include appointment of non-governmental community leaders in advisory roles. So, I cannot believe that we would not include non-governmental community leaders. Like
we would definitely be including them.
Yeah, hospital administrators,
that
to begin with, health, you
goes
know.
with it's obvious, very obvious.
Yeah,
If I may, Mr. Chairman, I
yeah,
think
Mr. Wade.
one of the comments that we had received in the worksheets was from Ms. Siciliano, which she said that we should, and I don't mean to speak for you, but that they consider including a health system ethicist. I think there's a tongue twister
Ah, yeah.
to make sure that you know, someone that will understand ethical guidelines. Am I quoting it right?
Are you able to hear me?
Yeah, barely.
All right. I don't know why this is not working today.
But we're gonna be real quiet and listen. You talk loud.
Let me see if I can keep going, and I'll see if I can turn the volume up here somehow. I don't know what's
We can
going
hear you.
I can hear you good. Well,
now. Okay, good. Hang on. Sorry. I've been trying to pop in here. One thing I was going to say is it seems like there's a thread of communications issues that are going through here, and I know they're under individual sections, but I wonder if there's a way of kind of putting all those things together in one as opposed to all these separate sections, Mr. Chairman.
well, some of these we're doing nothing on, and some of them we're gonna include in a letter. And I think in the letter, we can combine all these things. Does that answer? Does that kind of help?
Yeah, yeah. I'm just from the perspective of someone who handled communications from the hospital's perspective during COVID. That to me was one of our biggest issues. I'm going off the subject here a little bit, but one of our biggest issues was just kind of a crisis communications plan is kind of how I think about it more. And a lot of these things would fit underneath a category like that in a letter when we talk about that. And I think it could be applied to someone else made the point of, you know, what does the next one look like? I think you can do it so that it could apply to any pandemic or any kind of situation. But that was one of our biggest challenges.
Yeah, no, that's good. I know, I remember Benova spending a lot of money on a vaccination site, huge money for massive, and it was never really used.
Yeah.
And maybe, I don't know if that would have changed with the better communications plan, but apparently there were easier ways to get the vaccine out. But thank you for all that money y'all spent for your former employer.
That's right.
I have Mr. Chairman, I just have a general comment.
Who is that? Oh, Senator Favola?
Yeah, me. I would just say in our letter, as we're getting into the communication stuff and a lot of other things that just make sense as best practice, I think we need to emphasize the theme of equity and reaching underserved populations as in the communications framework.
How about in the letter, employing the use of community health workers? We were just talking about that in my previous meeting.
Yeah.
And that, I mean, the reason that they're so hot right now, as far as helping, is the unbelievably good job they did during the pandemic.
Right. Right.
And to be fair, I think we've learned a lot of lessons. I mean, a lot of things that, you know, that we're addressing today, we've learned a lot of lessons, but I still think having a general framework and how we work in the future is a good thing. And I do want to second what you said, Mr. Chairman, about the community health workers as well, because they were an integral part of getting through it.
Absolutely.
So we're going to have in our letter, we can go back over this later if we want to, that we need a crisis communication plan, and we need to fully employ community health workers to get hard to reach populations.
And I would say, and other leaders too. I mean, I don't want to get fully, I mean, you don't want to lock yourself in.
No, let's put the city council and the board of supervisors in.
I mean, you know.
No, but to that point, having it pre-established in some way, like the pre-established part is a good thing, because that was one of the challenges in real time, is figuring out what that should look like.
Mr. Mark or Mr. Polster, do you have any comments on that? About what would, you know, the crisis, this whole crisis communications plan?
Excuse me. No, I mean, I think we'd have to, I think in the letter you could talk about that. I do think that there were some, I know that VDH kind of rose to the challenge, and there were daily for a while there were daily briefings and giving out important information. I do think leveraging, I think Mr. Polster could probably tell you that VDEM would probably leverage the SMEs, including the private sector,
Yeah.
adequately. There were a lot of resources brought to bear. So, I mean, I just think adding it to the letter, that's fine, and we can see what is currently existing and how those resources would be developed and dispersed. But there are a lot of very well qualified and well practiced public servants dealing with these types of issues. So I
Okay.
think a plan is fine. I don't think legislation is necessary.
Okay.
So we'll come back and look at that.
Okay.
Mr.
Mr.
Chair, I
Chairman?
agree. I
Yeah.
think one of the things that the Virginia Emergency Support Team leverages is over 100 state agencies, private sector partners, as well as nonprofits. So you look at VHAS and some of the other professional associations, having them at the table is imperative when we have these calls and through the communication.
Can you send us a blurb on that?
On the VEST, the
What you
Virginia
just
Emergency-
said?
Yes,
So
sir.
you can use it as a, framework for our letter,
Yes, sir.
that we know this stuff exists, but okay. Thank you very much. You can send it to Mr. Wade, to incorporate what we need to incorporate in this unbelievable letter we're gonna do. Okay. Moving on.
Multi-page letter.
And I know. Okay.
Okay.
So we're moving on, unless there's objection, I'm gonna move on to operations here.
Mhm.
It's 711, conduct comprehensive NIMS and ICS training. Okay. Section 2.2, blah, blah, requires human resource management to develop training programs familiar. Rise the director of each agency in the executive branch of state government with state human resources policies. Each agency director is required to attend the training within 6 months after appointment. Okay, that's just a fact. Legislation could be introduced that would similarly require VDEMs to develop a training program on NIMS principles, the ICS, and the role of EOC. Can you explain what that means? Somebody, Mr. Polster?
So I don't know what the intent of this was. I don't know if Mr. Wade wants to speak to that, but sir, I will let the committee know that this already exists in EO 41 and 42 and the COVOP. The incident command system training and understanding of roles and responsibilities is laid out. And we just need to make sure if this moves forward, we synchronize the approach and know who is really, leading this, if it is VDEM, if that is the direction, or if this would stay as a best practice as it is in EO 41, 42. We work with our private sector partners as well as other state agencies to make sure that we're sharing those resources, sir.
Yeah, and I would just add, if you've all never been out to the VDEM's facility out there on Midlothian, it would be a good educational tour, informational. They've got it all set up. They know what they're doing. They don't. They just fall off a log and they start doing it. It's not. They don't have to reinvent the wheel all the time. But I've been out there many times, and I highly recommend it for you all.
So, these recommendations just didn't come, this came from people involved in the process who saw weaknesses in our system. Someone didn't just dream this up.
I get it.
Someone out there is not happy, who knows about this stuff, is not happy about what happened in this, in this situation. I mean, I believe you that that's okay, but do you have any speculation on why this even made the report if it's so good?
So, Mr. Chair, the only thing I want to say is, as I said before, this is a retrospective look. This was almost 4 years ago. So we have adapted. We have changed some of our tactics and techniques to ensure that we're meeting the current threat. There's always opportunities, sir. I'm not saying there's not. There's opportunity for, the opportunity maybe to have DHRM say, ICS 100, 102, or 200 is part of the state agency required training. So there are opportunities that we can explore through the EO. So I'm not saying there's not, sir, but that may offer one piece of insight into that.
This would be a good one. I asked the committee here for us to get briefed on what has been done in this area since because that was just news to me what you just said. So that would be good for us all to learn, if you wouldn't mind doing that. So what else do we have here? So we got some of y'all like this idea, but they say that they've made improvements here and that agency directors should know their personnel policies now after this experience.
I guess my only comment there is, with turnover, just ensuring somehow that the people that have, the responsibility are familiar with the process, I guess I would say. And to be fair, if that's changed since the pandemic, and I'm sure it probably has, that hits that. But that was my reason for saying yes, that maybe not legislation, but just some sort of a process that ensures that those who have the responsibility when there's a pandemic or whatever emergency situation really understand and also know how to interface with everybody, not just know the process, but know how to interface with everyone.
Mm-hmm.
And Mr. Chairman, just to kind of, again, to add context that we got this document whittled down to just what the recommendation was. I think that this particular policy option came from what was in the final report based on the surveys where the respondents to the survey was saying that it didn't seem like some of the leadership knew about the NIMS principles, and so that's where the policy option came from. So
I see. So maybe it wouldn't hurt then to amend section 22-1209 to say, I'm just saying, to say where appropriate, department heads should be trained on NIMS principles as well.
Yeah, I would agree with that because you want to make sure that happens.
Okay, that would be what I'd consider a minor bill.
Right.
But it may be important someday. Any thoughts? So, any thoughts? If not,
Mr. Chairman,
yes, Delegate Gardner.
as a former agency head, although that was years and years and years ago, I would have to say, if you put it in code, we would do it. But if you don't, people may not do it. And I just think it's important, if it's a minor thing, that we ensure that they get some type of training.
So is okay? So is everybody okay with the what I said about where appropriate? Because you don't want to train every department head on this, right?
Right.
Where appropriate, they get NIMS training too.
Right. I think that's right.
Okay, legislation.
I agree.
Yeah. And when we move to 7.1.2, I have a.
Okay, let's move to it now, unless there's a reason to not move to it.
Actually, I would do legislation that directs the agencies to develop a document that outlines their incident command system and the role of the Virginia Emergency Support Team in the event of a declared emergency. I think for an agency to have something on the shelf that actually says who in the agency might have which responsibilities and how they would actually respond to.
Yeah, a lot of it, yes, Senator, a lot of agencies already have a continuity of operations plan.
Oh.
And so when the emergencies come up, something's already written down, and there's Mr. Polster can weigh in when he needs to, but that's where the clarity is provided. There's got to be something if somebody's not there or this happens, then
Right.
who comes in? I mean, everything from the COOP plan, as we call it, nickname it, falls into everything from, if who's necessary, if something happens, something goes wrong, and somebody has to be in. When we had COVID, even though 95% of the agency was out, we still had people in the office working because we had to have an emergency operations center because the mail kept coming in and you can't receive mail at home. So, we had legal obligations. We had to have places for the sheriffs to show up to receive the whatever. And so you have to have that all worked out, and agencies are supposed to have that.
How often are they updated, Craig?
Pardon me?
How often are they updated?
Well, I can speak for DMAS. Medicaid, we would update it annually
Okay.
because
So
I do think it's worth having legislation though, directing that to happen and having it updated periodically.
Yeah, I know that the executive orders and the Code of Virginia, there could have some clarity.
But it's EO 41 that requires
41.
state agencies in the executive branch to have a continuity operation plan. Senator, it's a great point. It's something that we talk about quite a bit. One of the things that we also have in the emergency operations plan is emergency support functions. So health would be a function, communications would be a function. And it really, to your point, ma'am, spells out the delineation of communication as well as our responsibility. And the interesting thing with the National Incident Management System is that command structure is scalable, or you can reduce it based on the growth of the incident or decrease it based on the evolution of the incident. So more than happy to provide more information as well, Mr. Chair, Madam Senator, as needed.
Okay, so Senator Foley, you still think a bill is necessary for this?
Oh, I don't know. I just think it's so important that it really does need to happen. And we want to make sure it's updated as well. So I'm not sure a letter was strong enough. And sure, they can do it through executive order. But
What
I
would
actually think
be,
it's important, but
Yeah.
I can be persuaded.
well, I'm thinking, so what our interest is that people don't forget this because there's so many other things to do. You're not going to have an emergency tomorrow. You got a list of things on your desk, but we want to make sure that everyone's doing this and being prepared and know how the National Incident Command works. And how do we make sure that that happens every year? Even if we pass a bill, not going to guarantee it. Who's going to sue somebody? Your plan's not out yet. I mean, Congress would not even exist if they did. I mean, they've never met a deadline ever
Right.
that they make for
Well,
themselves.
and agencies don't meet the deadline sending reports to Congress. I mean, we can ask for a periodic report on whether these are updated.
Yeah. Why don't we do it every 2 years?
Sure.
Or maybe
That's fine.
but a report that's not that hard to do, something that you can just use to make sure that, we're thinking about the bad times when we're in the good times.
Yeah, I think that's right. And so we're expecting them to do this, and they can report to us every 2 years that it's what the status is, that it's been done. I don't think that's unreasonable, actually. And it does sort of move it up, legislative language or budget language. It does sort of move it up to the top of people's radar.
Yeah. Yeah. I mean, agencies can do desktop, game things out. What happens if this happens? What do we do with this situation? What do we do in that situation? That's standard practice at DMAS. I'm speaking for DMAS. That's where I've come from. So I can speak to DMAS. So,
and Madam Senator, to add on to Mr. Markova's point, is the Virginia Emergency Support Team has training every 2 weeks on different topics. And we have multiple annual exercises to ensure that all the state agencies are exercising their COOP plans or coming to the table to have these hard conversations. Just wanted to add that.
So in the report, you can tell us how many times you've done that.
Yeah.
Just add it all up.
Yeah.
And send it over so everybody knows.
Yeah.
All right.
Yeah. Does,
VDEM's been a very reliable partner with all the agencies, preparing and then execution when the time arrives. So I can speak heartily to that personally.
yeah.
Right,
So,
Mr. Chairman, just to make sure I understand where the resolution is going, is it to have, I think we're looking at having a report done every 2 years.
and this, we're gonna file a bill,
Yeah,
Wade. But it might be even a section 1 bill, right? It's not,
yeah, just to get it in code and,
well, that won't get it in code, but
no, but it'll get it on the forefront of the statute. Did you want to put it in budget language, Mark?
uh, we could do that. Either way,
Okay.
yeah. But I would appreciate, help from the administration on what what you guys think needs to be happen every 2 years, and what we're doing is just helping to remind you that you need to do it every 2 years.
That's
and
right.
making it public, so the public knows what we're doing with their tax dollars too. Okay.
All right.
Okay. Um, without objection, I'll move to 713, enhance tracking resource management systems. Resource allocations dashboards, establish real-time dashboards to track availability of resources like ventilators, PPE, healthcare, fence bottlenecks. It's intended to ensure quick allocation where needed. Okay. And the Code of Virginia establishes powers and duties of state CIO relating to development policy standards and guidance for information technology for executive branch agencies. Legislation, adding a section directing CIO and VITA with the cooperation of VDEMs to develop emergency resource management system that integrates recommended information. Okay, so I guess whoever wanted to do this was not happy with how accessible. This is just more communications, isn't it? I mean, how accessible our policies were during this pandemic, and there was obviously some disappointment with how well we did on that, and it was a hard job. So we know it was a hard job. People want to improve it. So what do you think about this? The CIA, the CIO. I mean, adding a section directing folks to develop emergency resource management system, a system that integrates the recommended information.
So, Mr. Chairman, I think that if you look at those two recommendations, the first one is more of sort of a general direction that the dashboard should be done, or that should include that information, in terms of tracking essential resources. The second recommend option is really talking about directing VITA in conjunction with VDEM to establish, a emergency resource management system. So that's the difference between the two. The first one may be more appropriate for a letter, and the second one would of course be legislation. So that's, in order to just try to lay it out for the subcommittee. Or even a best practice in terms of the first one.
Excuse me.
Bless you.
Thank you.
Okay. Look at my notes here. So the first one is a best practice, number one for sure. Everybody okay with that? That should be not okay.
So what are you doing with the first one, Mark?
Well, I think it's a best practice to have real-time dashboards that track availability.
Right, I agree.
Essential resources.
Okay.
I mean, I guess you could pass a bill to say that, but
That's a best practice. I agree with you.
Agree.
Yes.
okay. And then the second part, it adds powers to the CIO's duties. And they coordinate with our agencies to develop an emergency response management system. that
Yeah,
integrates.
but I think that could be done through a best practice.
Amigo, you were saying you thought that needed a bill.
Oh,
Well, I mean, yeah, for this particular policy option, it is a directive to have that resource management system established. That
established.
emergency resource management system. So, if it's the will of if the idea is that you don't think that needs to be done, then
Well, do we, okay, somebody thought it needed to be done. What, you guys in the administration,
Mr. Chair, I would agree. I'm sorry. We would concur with this. We would say that it would probably need legislation as well as a budget request from the agency to work with the other agencies to create this technology.
so you like the idea?
We do. We concur with the recommendation, sir.
Okay, wow. All right.
Okay.
Anybody object?
No.
Okay, let's grow government at least a little bit more. Okay, legislation. All right.
Oh, gosh.
Okay, 721 policy. Pursuant to authority, BDM has established Project Management Office, a Human Resource Department, and a Disaster Services Planning function. The Joint Committee may wish to consider legislation with accompanying budget amendment providing that during a declared emergency, additional funding is directed to the department for expanding these functions to support an increase in temporary staff. So basically, this just says you would have a permanent authority to add staff if you needed it. Is that what this does?
yes, and I think, Mr. Chairman, Senator Favola indicated in her worksheet that she believes, and I would concur, that the governor already has the authority to do this in times of emergency, subject to reimbursement from the federal government and some other sources.
Uh-huh.
Oh, right. Yeah. I think I
Mr. Chair,
get-
I'm sorry, ma'am. Go ahead.
No. Nope, that was
Yes,
correct.
okay.
I was going to say this is done through some sufficient, Mr. Chair, is through state of emergency. Yes, sir.
Yeah, we hate that on the 12th floor.
Oh, I'm tired.
Just hold on, we're gonna make it.
We're gonna make it. We're plugging along.
I'm
I'll have a nice
tired than
long
you
ride
are.
home with all the people traveling for Thanksgiving. Jeez.
Okay. Oh, yeah. We put you on a train. So we don't need this. So we're gonna do nothing on the basis that we don't need 721.
Correct.
Everybody okay with that? Okay.
Yeah.
Yes.
Yeah. Okay. Implement rotate. I mean, I don't know why someone thought we needed it, but anyway, they did. 722, implement rotational staffing, surge staffing models, implement a system for rapidly deploying temporary healthcare workers, including partnerships with we did some of that as far as training people to give shots. A retired healthcare professional build a reserve work. We have that, don't we?
Yes.
We have yeah. Okay, section, I'm gonna go ahead and do 2 and 3 here.
Yep.
Could be amended, alternately, a separate section created, directing the VDMs to establish a system of rotational staffing to be implemented in times of emergency. Since rotational staffing for VEST during times of emergency would likely require funding to hire additional staffing, Joint Subcommittee may wish to consider a budget amendment clearly providing for transfer of balances or other means in times of emergency to cover the cost of staffing. I apparently we didn't have enough authority to hire more people when we needed them, or it was done in an inefficient way.
Oh. I can't speak to that. I wasn't aware that we had a problem with that.
I can't remember what this one was either, unless it was in some way trying to establish, if some areas needed it more than other across. I can't remember on this one, to be honest.
And Mr. Chair, just to add on to number 2, as we spoke about previously, we do have the adjunct emergency workforce of state employees who provide support
Right.
during times of emergency. So
How robust is that organization, that group?
I can get back to you with all that information, sir, but we did activate it during Hurricane Helene as well, sir.
So just recently.
Yes, sir.
Yeah. Are they always looking for more people? Does it have a funding issue at all?
That I don't know about the funding issue side of it, sir, but we are always looking for people that seek the opportunity to expand their knowledge base and assist Virginians in time of emergency.
Okay. Comments from anybody? I mean, what, if we did anything in this area, it would be in order to improve what we already have. Everybody agree with that? It would be, if we did anything, it would be to improve what we have already.
I would not think we would need legislation to do that, though. Do you guys?
No, I feel like that's almost a conversation with those that are directly impacted there. A little
Yeah,
bit
I
more.
mean, nobody, I mean, I've been doing this a while. No one's come to me ever with a request to do this.
No,
Yeah, right.
I think that's right. I would leave this alone, Mr. Chairman.
Yeah, I'm not needed.
Okay, nothing.
We don't even need a letter. Yeah,
Okay.
not
All
needed.
right, going on to the 723, expand and diversify the staffing pool. Helpful to include recommendations, discussion, communication workers in this discussion.
Uh-huh.
I don't know what that means. From an aspirational standpoint, partnerships are typically developed at the individual agency level. As for staffing temporary positions during a declared state of emergency,
Isn't that something they can do anyway? I mean, again, under an governor's executive order, I think they can staff up, they can do all kinds of things. And in my mind, if you want to say something about this, the diversification of the staffing pool.
well, that's the main point, I think, on number 2, Senator.
Correct, but I'm
Establishing
just saying,
workers on health and equity.
right, the value of this would be bringing those voices to the table who represent groups that are underserved or may not have equal access to resources and public health services.
Yeah, so now this is in the operations section
Uh-huh.
and we had a communication section earlier.
Right.
This is kind of a communications blurb that the operations subcommittee, or whoever that was.
I guess, Mr. Chairman, I would suggest then that we write a letter on this, articulating some of the things we just talked about.
You mean merge it into the other letter we're gonna do on communications?
Well, this is on operations. I don't care if you do one letter or two.
I think
This is a separate thought. I mean, it's a separate topic, separate paragraph. I don't care how you
Mr.
structure the correspondence.
Yeah, so, we don't want, people going into neighborhoods where they've never ever been seen before.
Right,
telling
that's
them
right.
what to do, right? That's what community health workers help get over,
Right.
that hump. And
So in community health workers are as much, are their communication and operations. I mean, they sort of bridge both.
the answer to this really is use of community health workers, it seems to me.
Mm-hmm.
Mr. Chairman, I
Yep.
think that this could be worked into the communications letter because what the option talks about is it refers to that work group that was talked about being established back in 2.2.1, which is a part of the letter. So I think that we can work this aspect of that is at least in option 2. We can work that into the communications letter.
So I like that idea. Anyone else like it?
Fine with that.
Everyone okay? Okay. We're gonna include in 2.221 letter.
Mm-hmm.
Okay. That means we're gonna go to the next.
It's gonna be a pretty long letter.
It's gonna be a treatise.
Letters.
We're gonna get a
It's gonna
PhD,
be a.
PhD in emergency. Okay, the next group is called planning. We're out of operations, we're in planning. 811, review and update pandemic and emergency operations plans. The first one has two policy options. Code of Virginia could be amended to require VDMs to
Drink my camera.
prepare and maintain a comprehensive pandemic response plan that assigns primary and support responsibilities for basic emergency service functions to state agencies, organizations, and personnel as appropriate. Legislation could also require the department to establish a model pandemic response plan for use by individual state agencies and local governing bodies. And number two, in chapter 6, code could be amended to require all state agencies to develop and maintain individual pandemic response plans. Boy, you know, that sounds like a lot of make work to me.
And Mr. Chairman, I will say that I did check that we do have agencies that have engaged in development of in-progress reviews and after-action reports and improvement plans. So I know VDH has implemented that to inform and change and update the emergency operations plan. So if something is not there, is necessary to add, then it's added to the plan. So they are doing real time analysis of what did we succeed with.
Well,
so I just think that's the best practice.
Any of your members here, Senator Favola, Delegate Gardner, do you ever remember seeing anything like that? You know, I wish that when you do these reports, someone would send them around, and say, so might be helpful. I didn't know that had happened. I mean, I presume it would happen just under good management of an organization, but.
Mr. Chairman, I guess I would not do legislation for 8.1.1 because we sort of talked about we already talked about legislation earlier, having the state agencies develop their responses and periodically update them every 2 years or report to us.
This is a little bit more specific. Am I right about?
It is.
What is your plan for the pandemic, the next pandemic?
Is. But do we know? I mean, do we want to be that specific? I guess is my question.
Yeah. I mean, the study, we're doing this because it was a pandemic, was.
But who knows what the next emergency might be?
Well, we've been talking today mostly about just general emergencies. I think, and now, which is a good thing. When we get to this and it's more specific, establish a model pandemic response plan. I'm saying let's not do anything, but I'm open. Delegate Gardner, are you left us for the day? I'm sorry that former Delegate Jones left because he was very helpful. Deborah, yeah, Ms. Cislano.
I was going to say, to me, I think, I don't know that I would do anything with this either, only because I think what we're talking about in general is a response plan overall. And a lot of the things that we have talked about today fit underneath that kind of a title, at least.
Framework, yeah.
Framework, yeah.
Okay.
And Mr. Chair, just from VDEM's side, we do have a pandemic influenza response plan as a hazard-specific annex to the state continuity operations plan.
So, have you revised it since 2000?
Yes, sir. We do the same thing with our cyber plan, with that plan, with the winter weather plan. We continuously review those policies.
Oh, wow. Wow. Well, congratulations. I didn't know that. I mean, I should have known that, but I didn't know it. Okay. So most of us seem to think we don't need this section.
I would agree.
Okay.
This is a lot of work. They didn't follow up.
We're moving on without objection. Okay. 8.1.2, integrate inclusivity and support for vulnerable populations. Gardner says no here. It would be useful to ask the state to plan, if possible, to ascertain the capacity of private healthcare providers in the respective regions. I don't know what that means. I do think
that's why I said no. I didn't know what they were saying.
Right. And Jen, I mean, wait a minute, just a second. On the second point 2, require VDMs to repair and maintain comprehensive contaminant response plan, which they do already. That includes component requiring inclusion of community stakeholders and representatives who represent populations in an agency service area likely to be affected. Inclusivity of community stakeholders and representatives would be included. Yeah. Well, of course. I mean,
Mr. Chairman,
yeah, yes, Mr. Solon.
I'm wondering if the first one, for some reason, since it is a look back, had something to do with the nursing home situation. I don't know. Just wondering if maybe that's where that came from.
Oh.
Yeah.
I don't know, but it could be.
Yeah, that was a cluster.
And I don't know if that's, you know, from like a bed registry perspective, or I don't know where that, it's very broad.
Yeah, I can tell you VDH already had a working group on health equity and long-term care advisory group. And they did an access and functional need. They had access and functional needs officers that served at the command level of the unified command there with VDEM. So, you know, I do think a lot of that is already being addressed, has been addressed in the previous emergency. So,
yeah, also, I don't know if you agree with this, Mr. Marfa, but we've come to the conclusion that these community health workers are an essential part of this. You know, making sure everyone gets in. You know, we funded it a little bit higher than we did before, and I think there's going to be more of that coming, which should really be helpful, you know, on spreading the message.
Well, it certainly addresses, you know, integrating inclusivity and support for vulnerable populations. So I think you've already addressed that. So I don't know if this is necessary.
Yeah. What do you think, Mr. Wade? Is this, we think, I mean, I think I'm hearing that we've got this covered. This report, as I said at the very outset, it tends to be a little bit repetitive, you know.
Well, it is certainly the will of the subcommittee. If it's already covered, then there's no need to have a specific policy option to go forward.
Yeah.
Okay. I tend to agree with you, Mr. Chairman. I mean, at the end of the day, hopefully the governor will exercise executive judgment.
So, I mean,
and tailor things to the crises at hand.
I like to boil it down, and it says, require the VDEMs to prepare and maintain a comprehensive pandemic response plan, and they already do that.
Yeah. Yes, they do.
Okay. Nothing on 8.1.2. Okay. 8.1.3, prioritize continuous plan evaluation. I like this myself. I don't know if we need a law, but maintain a comprehensive plan that includes component requiring proactive and continuous value adaptation to the enabling department to regularly assess effectiveness, make adjustments, learn from ongoing or past crises. To me, that would mean not looking just at what happens in the United States, but what's happened when these things happen around the world, what we learn, because, you know, the ISO models are plan, do, check, act. It's a continuous improvement model. And we should have a continuous improvement. Do we need a law that says this? I don't know. But it says regularly assess effectiveness and make necessary adjustment. Review such plans. I mean, isn't that just good business?
Yeah.
Yes.
This was my point of in asking like how often they update the ones that they already had.
Right.
So to me, it's a little repetitive.
I mean, you could mention this in your letter again.
The letter.
The letter.
Yeah.
Yeah.
I mean, I like the way it's worded.
Yeah.
This could be another piece of the letter.
I mean, we should learn from anyone who has one of these crises, not just that happens to us.
Right. That's the important part. It's sort of a reflective evaluation piece. Yeah.
Well, I would definitely encourage the members of the full committee to avail themselves of getting a demonstration and an explanation from VDEM, just to go and see the site, see what's required, what they ask of all the agencies. They've got COOP people, continuity of operations people, emergency, what to do, whether it's an interior emergency or an external of their customers or their Virginians. So I highly recommend. I just think, and just for the benefit, I'm not trying to dissuade you all from this thing, but I do think that there's a lot that's been done.
I mean, I think the important thing here again is the continuous nature of it.
Continuous, yes. And they are supposed to update it. If there's an agency that hasn't reviewed something in the last 5 years, they're definitely out of compliance. So, if it has a date that's older than 2001, that'd be the worst case, I would say. But I just don't think that there's that many that are out of compliance with that.
Yeah, I wonder what we can learn from agriculture in this nature, because boy, once that avian flu gets in the turkeys over there in Rockingham County, it's a disaster.
Well, it would, but it's not going to happen. Not on my watch.
Okay, very good.
We bought these fancy pieces of equipment where farmers can, take their animals, and we can tell within 4 hours if it's the avian flu, and we can contact other farmers. I was on a tour.
Wow.
Yeah.
Okay.
Am I correct? Which is, I'm sort of simplifying it, but.
I can't speak to agriculture, but I'll tell them you were talking very positively.
Positively, yes, about my tour with the ag committee.
Yeah, no, that's good. And that's in everybody's self-interest too. I mean, people want to address that.
Yeah.
It's definitely is.
Yes.
They not just protecting themselves, but their neighbors and also their jobs. So it hit them in the wallet, and people pay attention.
Okay, we got a couple more in section 8 here. 821 is review alignment of emergency management and public health regions. So be useful to ask the state to plan, if possible, ascertain the capacity of private healthcare providers affected regions. We talked about that a little bit earlier.
Yeah, I know that VDH already we have 35 local health districts. They have 5 regions. They have plans on what to do in emergency. They have a designated emergency coordinator, an epidemiologist, and a public information officer. They're already deployed. They're in regular communication. I just don't know if there's anything additional that needs, at least from an HHR point of view. We definitely can tap into that when we need to. They're ready to go.
Okay. So,
Mr. Chairman, if I may, I think you had indicated in a previous comment that you thought that item 3 might be preferable, and that's the item that would call for VDEM and DH, the health department, to look at the regions and basically study it and come back with any recommendations.
So I'm interested in your point of view, but isn't it true that the communications and the problems with OEMS and VDEMs, isn't it a challenge? We won't tell anyone what we say. This is all go to silence here.
Mr. Chair, I'd say it isn't a challenge as much as it's an opportunity. It's an opportunity to do something different and try something better that we haven't tried before. And I think that's something that VDH and our agencies try to do with regular meetings, regular cadence, and events like this, making sure that we have that communication in different methods that we're on the same page. So I wouldn't see it as a challenge, it's more of an opportunity.
So, because you're in 2 different secretariats here, right?
Right.
So
he's under public safety. He's all law enforcement and I'm all health. So,
Yeah.
Mr. Chairman,
Yeah.
just
Senator
for
Pavone.
for clarity's sake, actually, I thought this recommendation made sense about aligning the regions. So did I hear that this has been done or that somehow you think it's working the way it is? Because I actually think it might be a good idea to have them aligned.
I can't speak. I can't speak to whether they're aligned. I can. I haven't. I haven't looked at public safety's alignment or where their districts are.
So,
I
Mr.
could say-
Chair, Madam
Yeah.
Senator, to your point, we have 7 divisions for VDOW. The Virginia Department of Health has many more health districts.
Oh, I
Like
see.
So
33
there's a
or something?
disparity in those two numbers. So there's definitely opportunity in this area to create a better communication system. Yes,
Do
ma'am.
we do a section 1 bill, Mark, and have them study it? The efficiency or effectiveness or I'm just
So,
throwing that.
Mr. Polster, do you have any kind of agreement, like you have 7 divisions and Division 1 has health departments 1 through 8, Division 2 has 9 through 25, something like that?
Yes, sir. And Mr. Chair, there's overlap as well. So you may have a health district that touches 2 different divisions for ours. And to his point, under public safety, fire programs, Virginia State Police, VDOT, all have different districts as well.
Oh.
And it's important, when we talk about an all hazards approach, that we make sure we're communicating through multiple layers to ensure there's not any silos during an
And the
emergency.
other issue is that, in most places in Virginia, Department of Fire programs and the fire programs have EMS.
And
And they're regulated in OEMS and not the fire programs. That's just within the health department. probably.
Yeah,
Is that-
I just want to. I just like because I'm just trying to figure out. I don't have an understanding. I'm trying to figure out what it is that we're trying to fix. What's not working.
Well, there's a urban legend out there that the 2 agencies don't work that well together.
That's, yeah.
Yeah, but that's just an urban legend. That's
Okay,
not
it's not true.
That's not,
Everything's-
I wouldn't put much credence in it.
Okay.
Yeah,
Well,
and Mr. Chair, I'll say just for the record that I've been a paramedic for over 33, 34 years. And I have a lot of friends over at VDH and everywhere else, and I pick up the phone on a regular basis and talk with them. So I think we have a very good relationship.
Yeah, we're talking all the time. So I'm honestly trying to figure out what we're trying to correct here. I'm
Well, we're trying
concerned
to make
about
government-
alignments could
We're
be.
trying to make government be more efficient. We're kind of
Well, I'm all
transforming the
for
government.
that. I'm all for that, sir. I'm
And
just saying.
also, and also to be, if I may jump in here, to be more efficient and to be more comprehensive in serving the constituent. So it's more of a one-stop shopping model for the Virginian who needs services from both, the emergency division and from the public health. So I think
Right.
one-stop
but I guess-
shopping is a fancier way of saying, I think, what Mr.
Yeah, no, I get it. I'm just concerned as far as the alignment, how many county, how many localities in one district versus another. Sometimes it's based on how resources are distributed and
Sure.
so that's all. I'm just trying to, I don't want to try to mandate putting a square peg in a round hole just for.
I don't think we'd mandate it. I think the question is whether it's actually worth a study and having you respond to the issue.
Yeah, I think the more we talk about it, the more I think we need it here. I mean, just the number 3 here, Section 1 study, as the senator said, to just check on whether our alignment are,
Yeah.
we're all, this is the best way to organize emergency response in Virginia. And we have these other issues too, as you guys are well aware. In rural Virginia, they can't afford to buy an ambulance. They can't afford a fire apparatus. They're looking to the state to help them out now and things like that.
Well, maybe we could just have Fairfax give their old stuff out. So
well,
they got plenty of it. They're getting rid of stuff all the time. So
well, I'll talk to the chairman about that.
that's good.
Yeah. Okay.
Chairman McKay, right?
Yeah.
Okay, all right. I think we're in the right place on this one.
Yeah. Okay. We're going to do a Section 1 study, Bill. I don't know if
Mr.
it's gonna
Chairman, I
pass,
just wanted to,
whether the governor will veto it or not. Like he loves to veto Section 1 bills for some reason, but we can
Mr.
give it a
Chairman,
shot.
if I may, it doesn't have to be a Section 1 bill. It could be a study resolution,
Oh.
which does not go to the governor to be signed.
Oh,
Oh, okay.
okay.
Oh, wow. Get her.
Thank you for helping us out.
I finally earned
So-
my pay today.
So, amigo, would that study resolution then go to my JLARC?
No, it would be a study. I mean, if you're looking at this option 3, it would be a study resolution directing BDEM and DHP to conduct that study and report back.
So we go through the rules committee.
Yes.
VDEM and DHP, you said?
But that's what's listed in item 3.
Yeah.
And
It's
not
VDEM and
DHP.
Health Department, not.
You mean
not
VDH?
I'm sorry. I'm
You mean
sorry.
VDH, right?
Yeah, it's the Department of Health. I got my acronyms. mixed
Right.
up.
Okay, we'll work on that. So we're gonna say study on that one in your categories. That'll be
Okay.
study. Okay.
All right. So
Okay.
Any objection?
18.2.
You can't go wrong with a study, Mr. Martin.
No, you can't go wrong with
Something
study. We
good.
do hundreds of them every year.
Oh, brother. Oh, brother. You said hundreds of
Well,
them.
how about,
It's a
why
little
don't you give
much.
us,
I think that was a dig, Mark.
well,
We
I
were
can
just,
take it. Look, I can take it.
we're just giving a
What,
dig.
what we need is a list of you of the studies that are not necessary anymore, so we can relieve your burden. You get it?
Is that going to
Yeah,
be
you can
included
send
in
that
the
to my
letter
personal-
too? That's great.
You can send that to my personal office, okay? About studies that are not necessary anymore, okay? Thanks. Okay,
Okay. Thank you, Mr. Chairman.
you're welcome, you're welcome.
All right.
I'm
We're
here to
going
serve. 822, integration of key internal external partners. Okay, Jen, this is something that we're going back to the subject again. Develop, you still with us?
Yeah, we
Jen?
sort of liked all of these. Yeah.
Develop a unified command structure for regional health and public health authorities to improve coordination. Conduct regular multi-agency drills that simulate pandemic scenarios, focusing on vaccination distribution, contact tracing, care for vulnerable populations, will expose weaknesses and provide. Okay. All right. Basically, this is, we've already talked about these things. Have we not? You, Mr. Polster, you said that we do conduct regular multi-agency drills. I heard, didn't I hear that today? That, I mean.
Yes, sir. I apologize. I stepped away for a moment to get my power.
No problem, no problem.
We do monthly exercises as well as tabletop exercises, larger exercises with the agencies. You are correct, sir.
So does anyone want to talk, somebody thinks we really messed up on this during this pandemic, not having regional command structures and stuff. I mean, we missed the mark, somebody thinks. Jen, you want to have anything to say about this since you were involved in a big way, big chunk of the state?
I just think it was the unknown, you know what I mean? Like, and through no fault of anyone, right? It just was an unknown, and having that structure, I think, once we established it, I think, it worked. It worked. Sometimes it didn't, but I do think it's important. And again, this is looking back. So I have been a little bit removed from some of that, that I was in Fairfax, that I am now in Charlottesville, but it may be that it's been addressed.
Mr. Chairman, I think one of the comments that had been received was to make sure that that Virginia hospitals and the health system was included or integrated into some of these efforts, including perhaps a VHHA representative in this process.
That was
I
my
think that may have come from you.
Yeah. No, I heard that in real time. Big time. Yeah. I heard that in real time. I mean, the hospitals were very frustrated.
Yeah. Mr. Chairman, I would put 1 through 4 back in our letter, our wonderful communications letter. I don't think legislation is going to fix anything that's here, particularly. Um, I do think that the points that are made are valid and can easily be addressed if somebody just really thought about who the partners are, where the services are going to be provided, and how to strengthen the boots on the ground response, because people were going to emergency rooms, people were going to clinics, they were going to mobile units. And the direction or lack thereof that hospitals were receiving from the state, it was definitely problematic. I mean, it wasn't smooth, it wasn't even consistent. They'd get directions to do X, or be told that a certain supply was going to be coming in 2 weeks, and then 3 days before the supply was supposed to arrive, that supply was reduced, and they had to scramble after they'd already gone out with announcements to the public. So
I think Senator Favela, absolutely agree. I think this goes back to, Mr. Chairman, to what I was talking about from a framework, if there is a general framework in place. I don't know that you agree. I kind of agree that I don't know if you need legislation for this, but, and to be fair,
yeah,
it was an element of this that was of the uncertainty that was coming from the feds too.
right,
So,
right, yeah. I don't mean to be disparaging to any of our officials, because I think everybody did the best they could with a very
yeah.
uncertain environment, and nobody had a playbook for this. I mean, we were making it up as we went along, and you're right, Jen, there were lots of surprises from the feds, there were lots of surprises from suppliers, lots of surprises, in terms of the populations we were supposed to serve first. Yeah, just
Okay, so.
Mr. Chair?
just
Oh,
to
sorry,
sum-
sir.
oh, yeah, go ahead.
One of the things that we learned from the pandemic, as well as the snowstorm in 2022, the OSIG report actually mentioned everything that you guys are saying. And we took that to heart, and we started regional coordination centers, RCCs, in each region when there's an event. Such as Helene, we stood up a regional coordination center down there and invited all the state partners. It's not mandatory, but we opened the tent up and say, everybody come in, nonprofit, state partners, and we're all in one place in the regions to help coordinate that response from where it's happening. So this is something that we've changed since COVID and since the 2022 storm, to your point, of best practice.
Okay,
I'm just really glad we're learning, and we're making amendments and changes. I just think that that's really what good practice and good government's all about.
right. So, just to review here before we move on to the next one, we have a unified command structure policy. We have regular multi-agency drills. We've created regional communication hubs, and we don't have develop a public communication framework that simplifies delivery of consistent information.
So, Mr. Chair, I would say this goes back to the JIC, or the Joint Information Center.
Mhm.
Ensuring that when we have an incident, all agencies are represented there, and we're using a uniform message to push out to the public, to elected officials,
Okay.
so we're all on the same page.
All right. So whoever had all these complaints, they didn't know what was going on. Just
No, sir, I'm not saying that. I'm saying this is a retrospective look,
I
and
I wasn't accusing them either.
Oh, okay.
I'm just kind of being sarcastic here because these came from people,
Yeah, it was just legitimate, but I think we've addressed a lot of them since then. I think
Right.
Mr. Polster is
Okay.
correct.
Okay, then we'll move along. So that was a nothing. That was nothing. That's congratulations. 822 is congratulations. It's we don't need to do anything on that. 912 public health, local health districts. We got 4
Right.
ideas here. Enhancing regional coordination is essential. Regular interregional meetings, shared resources, promote consistency, establish regional liaison offices, interoperable data system, invest in creating data collection systems that healthcare institutions can use during crises. Should be designed for real-time data sharing and analysis. patient surges, et cetera. AI-driven use artificial intelligence to predict resource needs, optimize staffing levels, identify vulnerable populations' need of intervention. AI can assist healthcare teams in making quicker, more informed decisions. Article 3 in Chapter 1 of 32.1 could be amended to require the health department to conduct periodic meetings with representatives from each of the local health districts to review district's pandemic response plan. So this is as opposed to the VDEMS, you have a pandemic response plan. How is the OEMS or Department of Health generally, are they involved in your plan, in your pandemic plan?
Yeah, yes, sir. When we rewrite it, when we initially wrote it, everybody's at the table as stakeholders. This is the Commonwealth of Virginia Emergency Operations Plan, and it is an annex to that, just as the earthquake annex, cybersecurity, anything else. So we do take that approach where we bring everybody together to review, and we do that. Yes, sir.
Question, Mr. Chair.
Sure.
So do we actually have regional liaison officers in each of the regions? I mean, is this a resource question? Do you need more resources, more FTEs? I'm trying to figure this out.
You're talking about the health department regions or the VDEMS regions?
Well, this says the local health districts.
So that's 33, I think.
30, we have 35 local health
Okay,
districts.
35, sorry.
That's okay. I do know, but some of the local health districts are locally administered and
some
are
are
operated,
state.
not part of EDH. And
Yeah.
that's, you all know that because that's your,
Right,
Fairfax,
it's up in
Loudon,
our
Arlington.
areas, yeah.
We don't want you messing with our health department.
That's,
Richard,
well, I mean,
bureaucrats.
then you don't want to mess with your health department, right? I mean,
No,
that's
absolutely not.
That's right.
I wouldn't be back here next year.
Yeah,
Oh,
well,
God.
we should just kick this one to the curb because we don't want to upset Arlington, Fairfax, or Loudon. So.
Or Manassas Park, or
Manassas,
or
yes.
Prince William.
Oh, goodness gracious! Yeah, now you're just getting into fighting territory.
It's really growing, isn't it?
Yeah, yeah. But I did ask VDH, and they have pre-established health regions that include regular inter-regional meetings. They've shared resources and centralized training programs. So they're all locally administered. So I think we're in the Department of Redundancy department here.
So Mr. Chairman, 9.1.2 is another one of these best practice.
Yeah, best practices.
In a letter, it's a best practice.
Okay. I'm good with that.
That's good.
Anyone else? Any objection? Okay.
Chairman, just very briefly, that's with the exception of item 4, which is a request for a legislative action. It's looking at 1 through 3.
Yeah. Well, we're not gonna do that one, I don't think.
No.
Gotcha.
Yeah, no legislation.
Gotcha.
I mean, if this becomes a problem, we'll come back to it.
That's right.
We'll do it. We come here every year,
Okay.
sometimes multiple times.
All right.
Okay.
Centralized public health guidance and oversight.
You taking my job away, Senator?
No, I'm reading out loud to keep myself awake.
Okay, we have.
I'm struggling.
Okay, we got 2 things here, and we had some suggestions. Do you want to go over this, amigo?
Yeah, the first one talks about centralizing guidance to ensure uniform protocols, and I think that policy option came from one of the joint subcommittee members, and so we don't have a lot of background on it, but some suggestions for that. We have them listed there, and I think that they go more towards a bigger, dealing with the federal government. So my agency doesn't have a lot of background on that one. The second one would be talking about possible legislation, and I think Senator Favola, I think in your worksheet you said that this could probably that item could probably be done without legislation. So I don't think that there is a lot here. At least I don't have a lot of background on the first one. I don't know if Senator Favola or Ms. Siciliano may want to comment, because in the initial feedback, you all thought this might be something we might want to discuss more.
So when they were suggested that we have centralized oversight for public health emergencies, that's what the incident command system does. It does it not? I mean,
Well, they have part of responsibility, but the commissioner of public health, the state health commissioner that power is vested in the state board of health and in the commissioner when the board's not meeting. So, board of health makes the policies, promulgates regulations, but the commissioner is responsible, answers to the governor. And the commissioner leads the entirety of VDH and all the way down to the localities. So the locals are ministered. They rely on the central VDH office for information and their employees. They hired employees through the state classified system. So it's still locally administered. So, but it all flows right from the top. I don't really establishing a framework. It's already there. Regional flexibility, the locals already have flexibility.
So you would say this is a best practice again for
I would say it's best practice.
number one?
Or if there's things that are missing, that they integrate them into those plans that they already have. But I agree. I think this framework is there.
Yeah.
Okay. And what about number two, to provide centralized oversight to ensure that all, I guess that's a best practice too.
Yeah.
Yep.
Yeah.
Okay. Got it. Okay. So that's part of the letter. This letter's really growing, Mr. Chairman.
I know. I'm glad we got Mr. Wade to put it all together for us.
Mr. Chairman, if it's just a quick point, if it's the best practice, it'll be in the list of best practices. It wouldn't be in a letter. The letter would be more specific. I think we have about 7 items for the letter, not including the best practices.
I say.
Okay. So let me.
Best practices are
Point
something
of
to be
clarification. So
referenced.
best practices would stand alone, but they should be captured somewhere.
Yeah, will be it'll be an annex to the letter,
Okay.
Yeah, here's the list. We'll refer to best practices in the letter and then people can read the list.
Okay.
Of best practices. Is that okay?
Yeah. That's better. Yeah.
Yeah. I think you'll find there's a lot of good best practices already in place in our agencies. So it'll be helpful just to inform everybody and be aware of what's available.
And maybe have it in one place. I don't know.
I don't know why so many people were complaining last time then. Okay, Article through Chapter 1, committed authorized health to provide centralized oversight. Okay, we already talked about that. They supposedly have that already.
Yeah. Mm-hmm.
Okay. So that's not even a best practice. That's like,
Where?
Yeah.
Yeah.
okay. All right. 921, inclusion of vaccination policies and definition of pandemic plans.
Is this done already?
I asked VDH and they said it was difficult to designate priority groups in advance. Because again, we've talked about, we don't know what the pandemic is going to be, what it's going to look like. So it would be hard to, if it's not affecting, infants and young children, prioritizing them first. I think again, it goes back to, we have doctors, we have professionals in epidemiology. They can make a lot of the direct calls on things like that. So I hesitate to tie their hands with legislation.
I think this is another sort of best practice, though. I mean, situational context is important.
Senator, someone thought that we need to amend the code to provide centralized oversight, but apparently already have that. Centralized oversight to ensure All regions adhere to the same protocols, enhance coordination, and reduce inconsistencies. Now, theoretically, why don't we have that now? Why wouldn't that be the commissioner's job?
I would figure that it would be. I'm not aware that it is not. There may be
I was
some,
reading it
there
below.
may be some localities that had maybe, they ran fast and loose with some things and sometimes, and somebody was upset by that. I don't know. I don't know what this is based on. So
Yeah.
I hesitate to speculate.
Did anybody think back about during this pandemic incident, out of control health departments? Or I heard a lot of incompetent health departments. Heard that a lot.
Mr. Chairman,
I don't know.
Yeah.
you're referring to the Article 3 of Chapter 1 of the Code
Yeah.
of Virginia could be amended.
This is, I don't know what someone ought to read that to us now. I'm shocked that
But they already provide, I think your point was accurate. They already provide centralized oversight. I mean, that is one of their main responsibilities.
Yeah, they're the ones that distribute the vaccines. That's where it goes through the health department.
Correct.
Yeah.
So I don't know what else. It is unclear to me what legislative fix this would.
Yeah, I'm not quick enough. If Andrew was on this call, Andrew, you on the call? I was going to ask someone to read it to us, but I say we do nothing on that because
I do too.
Okay, so moving on to 921. Inclusion of vaccination policies and definition of pandemic plans. Is crucial. Pre-planning can prevent confusion over priority groups. Engage,
But wouldn't they do that? I mean, wouldn't that be part of their emergency response protocol?
Yeah, so when we had a limited vaccine, and we had people dying in nursing homes, they were a priority. They became probably a little bit late, but they became the state's priority to get these elderly people vaccinated first. Am I right about that? So we didn't need a law, or we had a law, I don't know, to make that kind of common sense decision.
Right.
If you have limited number of vaccine, you give it to who needs it most. Do we need to put that into law, or go ahead?
No, I was just going to say, I think number 1 and number 2 under the 9.2.1, I just think this is best practice. I would not put either of these into code.
Agreed.
Any objections? Do we have any? Delegate Gardner, are you okay with that?
I am.
Okay, let's go to 922 then. Enhance, what about you, Ms. Waller? Are you okay with that? I called you out. You okay with that? Put it in a best practice category?
Oh, I'm staff with DLS.
Oh, I'm sorry. Well, you can speak up.
Are you
listening and taking notes?
Are you trying to give one of my employees a promotion? I need a budget amendment.
Hey,
We've got amazing employees at MeGo. I don't know how they survive us.
You know what our salaries are, Mr. Wade?
Yes, sir.
Yeah. Okay. All right.
We could fix it.
Okay. We're moving right along here. God, there's 7 more pages. This is driving me crazy because we keep talking about the same things. 922, enhanced data collection and coordination for vaccine distribution. Robust data systems are vital for tracking vaccine distribution, identifying gaps. Interoperability between agencies' data systems can improve coordination.
Just to remind you all, there was VDH established the vaccine appointment scheduling engine, and that was used extensively during the pandemic. So I had all the information. I invite you. It's still operational to this day. It's not, I don't think it's being used much right now. But they do, here, let me pull it up here. Oh, they got a site for a flu vaccine out there. So they're still on it, and it's an existing resource, established and has a track record. So data collection through that and coordination. So
Okay.
it's already done.
We did this before the pandemic, or this is thing?
I think that happened during the pandemic. I can't tell you when it was.
Okay. So on these, if we can stretch our eyes a little bit to look at the suggestions, I don't know if everyone sees this, with a mandatory inclusion of vaccination policy plan. States should pass legislation requiring pandemic preparedness to include clearly defined. Okay, I've already read that one
We
time.
can't legislate this, Mr. Chairman.
Yeah.
I think this is another best practice.
Coordination across agencies, seamless interagency coordination. Okay, best practice.
Yep.
All right.
Can we go to 9.2.2?
I was going to go to 9.31.
Oh, yes, that's good. Great.
Incorporate external partners early in response planning. I think that's a good best practice.
I do too.
Yeah.
I would agree.
Any legislation
Agree.
work group could require inclusion of representatives from relevant community stakeholders. Also, this is best practice for sure.
That's a best practice for sure. Yeah.
Yeah.
And now we're on 9.3.2, right?
Yeah. Clear communication channel protocols.
I feel like we've already talked about this.
Yeah.
Yeah,
No,
we
no
have.
kidding. Okay. So what did we do the first time? Best
That
practice.
That was going in the
That was the letter.
This
That
is-
was the letter with the communications framework.
Okay, which leads to the next question, the next point, strengthen and formalize partnerships before the crisis. That's the intention of this.
That might be
And,
worth emphasizing because
Isn't that 9.3 point? Wait, isn't that, I feel like,
9.3.3.
yeah, but isn't that what we were talking about in 9.3.1? Isn't that?
It is, but we were talking about during the crisis. and
Sorry,
this is
okay, all right.
before.
This is before, okay.
Yeah. So
it goes in the letter.
goes in the letter.
Okay, 3.3 is, okay, that is the letter. And then we've got, we're going to skip all the way down to
941.
941. I was looking above us, a permanent establishment require ongoing funding. Okay, we don't want to do that. All right. 941, a standardized framework can reduce redundancy and improve data quality. Legislation can be approved by DVMs and health to the study.
Of a
Development
data
and data
collection
collection.
framework as a contemplate.
Okay, what do you guys think about data?
That's interesting. I think the 2 is interesting.
So we are working with our partners at Agda to create the data governance and the data kind of dashboard behind this. All your points before about having a single point where you get data, single place you can see it in a repository. That is work that is ongoing.
Should we have them report to us on that, Mark?
Yep. So,
You could put it in a budget
budget
amendment.
language, yeah. You got that, amigo? Budget
Yes, sir.
amendment. Okay.
Yep.
All right.
VDH did note though that that this report didn't significantly recognize any or provide any recommendations for public health disease surveillance. So there's a gap, they said there.
Could you say it again? Surveillance?
I'll just read this as the report did not sufficiently recognize nor provide recommendations for public health disease surveillance, which is a significant gap. And it references VHHA data systems, healthcare data, which was more about resources and beds. They even acknowledged the UVA biocomplexity unit, but not the challenges and successes that VDH had with disease surveillance. So they've got a lot. I can send that send that off to you.
So they were a little bit complaining that the study didn't recognize the good work they did.
Yeah. Yeah, they were pulling out all, like I said, they were working 7 days a week.
Yeah,
They were very tired. So
yeah. Well, we need to tell them thank you and congratulations whenever we can.
yes, we
Oh,
Sorry,
yes, Mike.
I'm sorry we didn't do that. You know, it's just like my school board. You know, we give them more money. They don't say anything. They don't give me a thank you at all. No,
no,
thank
they
you.
just want more.
They just
Oh,
want more
come
money.
on. Oh, my goodness. That's
All right. Well, you know it's true.
that's our little ones we're talking about. They
You-
need a lot of resources.
Okay, I just
Having them graduate from high school in really high percentage numbers, that's your thank you.
You're
Well,
quite welcome. That's right.
yeah, okay.
You're welcome. They're going to protect you. They're going to fund your Social Security nest egg.
They're gonna communicate better.
We need more jobs so they can start paying into Social Security. Yes, that's right.
All
I
right.
start collecting next year, so I want more.
Yeah. Okay, 942, provide training and support for data reporting. Training is essential. Do y'all need any money for this? I mean,
914.
training is something we should do
We should
for
do,
these,
yeah.
for our data and reporting and our systems and all that. We need training.
Do they do this already, Mr. Chairman?
I don't know. That's what I was asking.
Yeah, I know VDH does provide training and support for all systems implemented. So,
Yeah. I mean, if I'd be very interested if we weren't funding this, or someone could let us know. So right now, I would say nothing.
yeah.
Right, I agree, because I thought we were already doing this and funding it.
And we're spending a lot of money on systems, and hopefully they're training people how to use them once we get them. Study on the number 2 on that one, study on development and implementation of data collection framework mentioned previously in the 941, but also include the requirement that VDEMS and VDH jointly develop a training program for any data collection framework produced by the study. Okay, never mind. So that's nothing. So I just want to tell you guys, if you buy new software and you develop new data systems, will you please train your employees how to use it?
And it's usually part of your cost of buying the package. So you usually
my
don't need
request.
extra money.
Well,
Please don't spend my taxpayers on things that you're not going to train your employees to use. I'm just asking.
well, the state, we got people that are using software that's 20 years old, and the people
Oh, I
that
know.
do
I
the
know
training,
about
they
the
died
Department
a
of
long time
Elections.
ago. So
Believe me.
we're
Okay.
trying to get the new. We can get training on the new stuff. That's the good part.
Okay. Good. Training on the old stuff is a problem. Okay.
Training on the old stuff is a problem, but that's never stopped us.
Yeah. Okay. We're on the last section, subcommittee, and it's 1111, comprehensive health and safety training.
Right.
So it could be amended to direct VDEMS to offer health and safety training to volunteer organizations that are incorporated into a best system. How about that? Mr. Polster, you do that now?
So we wouldn't object to it. We do have some of it. We have partnered with the National Voluntary Organizations Active in Disaster, VOAD is their acronym. We partnered with them on this and other opportunities. Yes, sir.
And this is not a bad idea, actually, to put into code. I mean, they are going to ask for money at some point, but I think they're already doing. It's not a bad idea, Mr. Chairman. I think I'd support legislation on one.
Isn't there an effort? I can't put my finger on the name of it in the community that like community work emergency. I'm looking to EMS to tell me.
Are you talking about CERT teams? Emergency
Maybe.
response teams, or?
I felt like there's already kind of a structure for this, or that there's a good model somewhere. I just remember there being some I can blanking on the name of it right now. I can't pull it, but I feel like somewhere this exists, a model for this exists, and maybe that's what you're talking about that we partner with.
Yeah, so we have VOAD, we have VAL, which is Volunteer Agency Liaisons, and they were very active during Hurricane Helene. But yes.
Yeah. So is there any, okay, so if we pass this and funded it, I think passing it out of committee would probably not be a problem. Funding it could be a problem up here on the 12th and 13th floor. And
Do they need money right now, or are they already doing it and we're just codifying it?
So, Mr. Chair, Madam Senator, I don't know the answer to that one. I can get back to you.
Yeah. And if we're talking about number one, I voted no because somewhere in my little brain, I thought they were already doing this.
Me too. And I'm trying to bring, and maybe it's like, I don't know, it was some sort of community disaster preparedness type thing.
I think there's some of it going on. Whether how much is going on, whether enough is going on, I don't know. But do volunteers get hurt out there frequently in emergency response? Because that's what we're trying to that's what we're trying to prevent.
So, Mr. Chair, I think the intent of this is comprehensive health and safety training. I think that, there's always health and safety training that occurs before people are deployed in the field, whether through their volunteer agency, through another unit. But I read the intent of this a bit different, is that it's more really intentful about what the ask is.
You want the volunteers to be more helpful when they're in the field, when they're actually in the emergency situation, better trained so they can be helpful.
Yeah, but we also just need to remind ourselves of human nature. At the beginning of the process, we didn't know what the virus, we didn't know what COVID was. And so it was kind of hard to get volunteers to go out for something at the beginning. It was much easier as it got moved on. But, I guess especially when the vaccine became available, then people felt more secure about going out and volunteering. So I'm not sure. I don't have any other details on for you for 11.1.
Well, it's not a bad idea of,
No.
to have.
Would you be, oh, Mr. Chairman? I don't mean to talk over you if you were done.
No, I'm done.
Oh, okay. If, I mean, do you think it would be helpful to have it in code? I mean, it may give you the opportunity to expand.
I think what Mr. Polster said about making sure the word comprehensive is in there, because under what I understand is under existing practice, no one, when there's a certain situation, there would be some on-site training before you would send someone in to do something.
That's right.
So comprehensive is a good,
That's a good word.
And, the federal government pays, as you all know, Fairfax County to go to these tragedies all over the world.
Right.
The fire department. I mean, the feds pay for that, and they certainly have comprehensive training and go to the worst disasters all over the globe. I don't know if we want a miniature version of that. We have also the National Guard, Virginia National Guard, that does some of this work, right? I mean, when do we pull them in? They actually, so, and have they gotten comprehensive training? I don't know.
I couldn't say.
Yeah.
So, Mr. Chairman, they do training prior to deployment with the National Guard.
Okay. So this is a potential legislative potential. We got to get it right.
Yeah.
Okay.
I agree. I think it's a good thing.
Okay. Then we've got 11.1.2, establish a health monitoring and support system, long-term volunteer networks building, and we need younger demographics, obviously. Okay, we need that. Do we need a law for that? Create a system for credentialing volunteers with relevant medical or logistical skills, quickly integrated.
Mr. Chairman, maybe in our training one, we can talk about, recruiting, having a comprehensive training program, bolstering the whole volunteer network. If we get the right language, I think, for the 11.1.1, number one, we might be able to pick up, long-term volunteer networks, and we can even credential.
I know from being at the VACO meeting the other day, the rural governments are extraordinarily worried about having emergency response people in the future.
Yeah,
Because
they are.
they depend on volunteers that are
Yeah.
going away. They just don't have them anymore for various reasons. So what do you want to do with this? To direct health. So they want a health monitoring system for all volunteers incorporated into the vest during times of emergency.
Mr. Chairman, my suggestion would be as part of the comprehensive training legislation, we put language in about, recruiting and bolstering volunteer networks,
Well,
especially.
what about keeping the health monitoring of the folks that have worked in emergencies?
Yeah, there's gonna be a budget impact on that.
Yeah, I don't
Yeah,
know what to
sure.
do with that.
Yeah,
I was gonna leave that alone, but I could be persuaded.
yeah, we're spending money now on firefighter cancer. We're
Right.
doing some money, spending money to try to find the best way to detect it in the current budget. You know, we can, so what you're suggesting, which I think we're leaning toward, is taking all 11.1.2 and putting it under the potential legislation in
Yeah.
11.1.1.
Yeah, that's what I'm suggesting.
So it would be a health and safety
Mm-hmm.
bill with regard to volunteers
Yeah,
and maybe some incentive to recruit volunteers. I don't know.
language about recruiting. Yeah, I mean, I think we could think about it. Amigo, are we making any sense? Could you possibly?
Yeah. I can see legislation that would amend 44-146.18. And it's a matter of what the full joint subcommittee wants to do. But yes, that I could see all that being drafted into a single piece of legislation.
Good.
Do it.
I think we found something here. Stumbled on something that might be helpful.
Yeah.
I mean, your point, Mr. Mark, about funding it could be a problem when we get depending on what's in the bill.
Yeah.
And I mean, we're both on the committees, but I'm used to getting turned down.
Oh, not you, Mark.
Yeah, last year I created a fund. I mean, Terry Austin and I were going to have a fund for fire and rescue apparatus, and that didn't get funded. And we're studying it more. We got the Wilder School
All right.
studying
Well,
it.
so you just So you're
Yeah.
just taking a slower pathway, but
So, it's a lot of money. I mean, the administration's position on fire and rescue was, hey, this is a local issue, not a state issue. That is what their formal veto letter said. By the way, Mr. Mark and Mr. Polster, that this
Wow.
is the fire and rescue is a local issue.
I mean, it's just clear that we don't have any room for tax cuts. I mean, that's what this is showing us. Okay,
Yeah.
let's move
Okay.
on.
All right. Well, that can't last because of what's going on out there. I mean, it can't last as a policy over the long term. And these are all Republicans, these that need this. So I'm sure it'll come around eventually. Okay. 11.1.3, engage a more diverse demographic. Inclusive. Okay.
I think these are best practices, don't you?
Yeah, I just it just one of the things that you may not be aware of is the Medical Reserve Corps units are in Virginia. They already have partnerships with local colleges and universities. So I do think that is. I asked VDH told me that their Medical Reserve Corps volunteers, their average age is 47.7. So retirees and volunteers over 65 make up only a third of the RMC volunteer pool.
Mm-hmm.
So this is definitely this would be an opportunity as far as trying to engage the youth and, as far as future careers and interest, et cetera. I think that would be a really great thing for recruiting younger people.
Do you need legislation?
I don't think so.
No, I don't either, but do you need a budget amendment?
I'd have to ask. I don't know about that.
Maybe
It
some
may be more
planning
of a,
money.
it may be more of a PR effort
Yeah.
and coordinating with
Yeah.
schools, local schools and
So
colleges.
basically what you're saying here is we need to create a culture of volunteerism
Yeah,
kind of lost over the years.
yeah, I do think that'd be great. And I think of everybody, I know when I was growing up, I got lots of skills when I volunteered and doing other things.
Mhm.
And it gave me an opportunity to see what I like to do, what I didn't
Exactly.
like to do.
Mhm.
And you get an opportunity to meet with, future mentors. It's a win-win for everybody. So I this would just be one of the programs that I would
Well, I
suggest.
think young people are looking for things like this right now.
They are.
And
They really
also
are.
we need to get them away from their iPhones.
And that is, and the Young administration is looking forward to your support on that bill. Thank you
good.
very much.
Well, I do support local control of the school system. Let me make that.
I understand.
I mean,
I think
That's good to hear.
government is.
I think the
close to
parents would
It's
agree
smart.
with you that having the parents local would be good to have authority over their own children when it comes to smartphones. Yes, we're in a great agreement on
Well,
that.
no,
Violent agreement.
there's no dispute on that. I mean, the parents should be involved.
That's right.
Yeah.
And they are, if you've ever gone to a school board meeting, just saying.
Mr. Chair,
Then they're done that.
Been there,
Mr.
done that.
Mr. Chair.
Yes, Ms. Gardner, Delta
I-
Gardner.
Yeah, I said no, and the reason I said no was because of the money, but I think it's a great idea if we could get young people involved. The only reason I said no was because I just know we don't have a lot of money. So, yeah.
So, are you gonna, Ms. Mark, are you gonna help us if we pass, let's say we put $2 million into a fund for somebody, the most effective person in government to start a volunteer program, outreach program for our youth, the governor won't veto that?
I don't know. All I can say is Medicaid is expensive. So you'll have to tell me, because when you all are dealing with Medicaid, you could help tell me.
I mean, and this could be
About $2
something we
million,
do in
but
2026.
you can write me a check for $2 million.
I mean, we don't have to address it this minute.
I understand.
This is
I understand.
fun.
Yeah, I'm just having fun with this. With the
Yeah,
chip.
and because it's 4:37.
Yeah, I get punchy after 4:00.
And no tax cuts.
And
Yeah.
we still support tax cuts after 4:00. Yeah.
That ain't happening, sir. Sorry. Ain't
Okay.
happening. You know,
Mr. Chairman, just to be clear, I think we're looking at option 3, and that's whether that should be a legislative. I think option 3 and option 4 go together. Just want to make sure I get down my marching orders correctly.
option. You talking about 111 or
No,
wait a minute,
11.1.3.
13? Yeah, you're talking about.
3 and 4 under that.
Yeah, I think we're talking about. I think we were both saying positive things about what 3 could do. You know, encouraging BDEMs to focus on recruiting.
I guess the
younger
question is, do they
demographics.
really need legislation to do this, or is this a best practice?
Well, you need some money, Senator.
Right, you need money. So,
Yeah.
so we
Because
just,
Medicaid's
it's a budget
expensive.
language, but we don't know how much money, and they are doing some of it now.
Could you do some planning, just some minor planning money for it?
No, okay. Somebody just said, we're doing this now, recruiting younger people to be involved in volunteer work.
Well, that's what they're, for the medical corps, that's what they were trying. They said the average age was 46, so they had to get on it.
And we're actually, I've not been aware of a recruiting effort in my area.
All right, well, why don't we give them education to do an education outreach campaign?
That'd be a nice incentive.
Why
Okay.
don't we do that? And we
Well,
can afford that.
We got to get it past the 3rd floor.
Yeah, yeah.
They're tough up there.
Okay,
You know,
well,
every dollar.
we'll try.
So, Mr. Chairman, are we talking budget amendment?
Yeah.
Yes.
Yes. I think it's Mr. Wade, I think it's a budget amendment more than it is legislation.
I agree.
Okay.
Yeah,
don't-
I agree.
I think they've got authority to do all this. We just need to focus on getting our young people interested in helping for the greater good. Think beyond themselves, have something that's greater than themselves to work toward, right? Now I think I'm on the, so we've gone through this whole thing. Mr. Wade, do you have any summary comments? And I've got on my agenda public comment. Is there anybody in the waiting room out there that wants to ask a question or?
Mr. Chairman, we have four people in the waiting room, and I'll ask them to raise their hands electronically if they'd like to provide testimony.
Thank you. Let's do that after, unless Mr. Wade has some
I'm
summary comments.
I was just going to say, Mr. Chairman, what I would do after this is Lauren and I will put together a document that sort of covers this, as well as having action items, which will be where we separately list the best practices,
Okay.
legislation and things of that nature.
Well, I think this has been real helpful in the sense that we had a lot of material here that was repetitive. And also, you know, we must have done some things not well for people to, this didn't come out of nowhere. This came from people's interviews with the consultant with these concerns. So, but I think we did a good job of going through what's important today. That's my opinion. And thank you. I want to thank Mr. Markfa and Mr. Polster for straightening us out on some of this stuff.
Happy to be here.
Okay.
Mr. Chairman, the meetings that have been longer, they've got a lot less done. So.
Oh, wow.
Mr. Chairman, I have to leave to reserve my room so I have a place to live.
Okay. Well, you can stay in my other bedroom if you want to.
Yes.
Oh,
Okay, I gotta go. Thank you.
all right. Well, okay. Let's, can you open up the room? Ms. Conway, did anybody want to give us their
Yes,
thoughts?
Mr. Chair, we have one member of the public with their hand raised. I am moving them into the room now. Shamgar Connors, you may unmute your microphone and begin your testimony.
Yeah, can you guys hear me?
Yes, welcome, Mr. Connors.
Hey, yeah, my name is Shamgar Connors, and I live in Stafford, Virginia. And I wanted to talk about the pandemic response committee stuff. Basically, I don't know if you guys have ever heard my story, but I was on the front page of Fox News and everything. I got kicked off the kidney transplant list because I refused to get the COVID vaccine from UVA. And then the doctor put in a message saying that I was so crazy for willing to refuse the safe and effective vaccine that I should never be allowed medical treatment there ever again. And that's all documented. I submitted the recording of the phone call the doctor saying this to me to the news. My wife was a nurse at Mary Washington. She worked there for an entire year on the COVID floor before, while the COVID was going around. And she never had the vaccine. It wasn't out yet. And when the vaccine came out, they mandated everyone get it. She didn't get it. They fired her. Okay. So I think what I want you guys to do is make a law or pass something that you can never be denied medical services. You can never be denied medical treatment. You can never be fired from your job. You can never have your life ruined from these psychopaths that want to mandate a vaccine that was never even tested and obviously didn't even work. If you remember, the CDC director, Biden and Fauci all went on the news saying, oh, if you get this vaccine, you can't get or spread COVID. They lied. They were wrong about all of it. Okay. I was right for not getting it. I'd be dead right now. And by the way, I had a couple of heart attacks. I would have had my kidney transplant already, but they kicked me off the list and wouldn't give me medical help. So you guys, somebody needs to do something and stop these psychopaths from ever pushing these vaccines ever again, ever pushing the masks ever again. We need to respect people's religious freedoms in this country and respect their rights. No more trampling all over people's rights and telling them, shove it, too bad, you're going to do what we tell you. No, you're going to respect our rights. That's how this is going to work. So you guys need to make policy and put it as plain as day that anyone that does this kind of stuff to people is charged with crimes as a terrorist and charged with crimes against humanity. They should be in jail for the longest sentence possible. Nobody should ever get away with doing this stuff to anyone ever again. It's pure evil what the people that were in charge of of all these response committees and all these other people did. Maybe not you guys, but anyone that was pushing the vaccine on someone and saying you have to get it or else you lose your job or you can't get medical treatment. You know, UVA actually, a lot of people contacted me. Their family members got kicked off the transplant list as well, and their family members are dead. These are murderers. Okay. And I've written to the governor, I've written to all sorts of people. No one cares. No one will do anything. They just let us give UVA more and more millions of dollars of funding while they just sentence people to die. Right. So something needs to be done about this, and something serious, because there will be another pandemic. You had Bill Gates talking about it. He said there's going to be one. You know it's going to happen. So you need to really respect people's rights. If they don't want to get a vaccine, oh well. These vaccines don't even work anyway. The whole reason my kidneys failed is because I had a tetanus shot and it caused me to go into kidney failure. Okay.
Okay,
So
thank you very much.
thank you.
Thank you, committee, for the long work today. I don't know, we started late. I guess we were in this for 2 hours and 45 minutes, something like that. And appreciate your views and feedback. And,
Mr. Chairman, I apologize to interrupt. We have one more member of the public who wishes to speak.
okay.
Um,
Thank you. Since there's only one more, we won't put a time limit on it like other committees have done, and the last one was lengthy. So, but if the commenter could get to the point quickly, we'd appreciate it.
Douglas Clark, you may unmute your microphone and begin your testimony.
Welcome, Colonel Clark.
Yes, sir. Thank you very much. Yeah, my name is Lieutenant Colonel Clark. I'm coming to comment on two issues I'm going to cover and recommendations in order to help fix these problems that are causing injuries and deaths in Virginia long after the COVID crisis was over. The first problem is giving the COVID gene therapy drugs being called vaccines to children. These are not vaccines. The CDC admits now that they do not prevent contraction or transmission. The CDC currently has these shots on the children's vaccine schedule, recommending 3 shots by the age of 9 months old. Surgeon General Dr. Ladapo called for the halt of the use of the COVID-19 mRNA vaccines. Dozens of countries do not allow the shot to be given to children. And I know many of you have children or grandchildren, so you can understand the importance of this. Dr. McCullough, a world-renowned cardiologist out of Texas last week, pointed out that the spike protein from these shots causes the body to produce damage virtually every organ in the body. And he called the shot, and I quote, a biological weapon. And this is a cardiologist that's known worldwide. Children's Health Defense has also come out against giving these dangerous shots to children. There's no documented case of a healthy child dying of COVID in the world. The life-threatening risks to our children far exceed any benefits. The second issue is hospitals continue to give patients remdesivir. Dr. Fauci mandated hospitals use this drug to treat COVID. Remdesivir has a propensity for shutting down your kidneys. This causes excess fluid to build up and the patient literally drowns. Doctors first thought this was pneumonia, but it is now known to be caused by this drug. Remdesivir was tested by the National Institute of Health in Africa against Ebola, along with 4 other drugs. Dr. Fauci was involved with the study. 2 of the 5 drugs were pulled due to them killing more patients than Ebola did. Remdesivir is one of them. France tested remdesivir during COVID and discontinued trials due to it killing their patients through kidney failure. Some nurses have even coined the phrase describing its use, and I quote, remdesivir, run, death is near. Dr. Fury presented to the Virginia Department of Health evidence for 2 years showing remdesivir should be removed from hospital protocols. Why hasn't it been done? So the solutions I'm asking you for things that you can do to help with these issues. Please recommend to the Virginia legislature and to the Virginia Department of Health that the COVID gene therapy drugs being called vaccines are removed from the children's vaccine schedule. This would put the responsibility solely with parents for injury or death due to these shots of their children. Second recommendation, to the Virginia Legislature and the Virginia Department of Health that remdesivir be removed as a method of treatment in Virginia hospitals. Known effective and safe treatments such as steroid inhalers, ivermectin, and hydroxychloroquine be used instead. Hydroxychloroquine has been used safely for decades to prevent disease, and ivermectin won the Nobel Prize in Medicine and is still listed by the World Health Organization as, I quote, essential. Please recommend that these available over-the-counter remedies, or I'm asking that you make these over-the-counter remedies available. You recommend that they're made available in Virginia like other states have. Other states and other countries, you don't need a prescription to get these. You can just get them over the counter. And I'm also asking that you solicit input and recommendations from medical professionals on the things I've just discussed, like Dr. McCullough, he would speak to you, and Dr. Sheila Fury's right here in Richmond. She would be very happy to speak with you.
Okay. All right.
Very,
I think we got the point. I appreciate
and I had
you.
and I had two more sentences and I'm done. And I wanted to let you know though that if you don't act, you are culpable against crime against humanity for injuries to the children because you've been notified. So I'm asking you to please seek professional guidance from people that I've mentioned, and please recommend that these dangerous protocols be taken off and save our children. Thank you.
Thank you. Okay. Thanks for being on the call, everybody that I'm looking at on the box here, and have a good evening and a wonderful Thanksgiving with your family. Appreciate your time.
Thanks,
You as well,
delegates.
Mr. Chairman.
Bye-bye.
Bye-bye.